4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending post-operative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Hello, and welcome back to our series on pregnancy. Today, we will be discussing week 31 of pregnancy and everything you need to know about your baby's development and your symptoms. So, let's get started. Baby development. At week 31, your baby is approximately 16 inches long and weighs around 3.5 pounds. Here are some of the key developments happening to your baby during this time. Rapid brain growth. Your baby's brain is growing rapidly during this time, which means that they will be able to process information more efficiently. Lung development. Your baby's lungs are almost fully developed at this point, and they are practicing their breathing movements. Sleep cycles. Your baby is now starting to have regular sleep and wake cycles. Baby fat. Your baby is putting on more baby fat, which helps regulate their body temperature after birth. Symptoms. As you enter the final trimester of your pregnancy, you may experience some new symptoms or the worsening of old ones. Here are some of the common symptoms that you may experience at week 31. Braxton Hicks contractions. You may start to experience Braxton Hicks contractions, which are mild contractions that help prepare your body for labor. Shortness of breath. As your uterus grows and pushes against your diaphragm, you may experience shortness of breath. Back pain. As your baby grows, the weight can put pressure on your back, causing discomfort. Swelling. You may experience swelling in your feet, ankles, and hands due to the increased fluid in your body. Heartburn. As your uterus grows, it can put pressure on your stomach, causing acid reflux and heartburn. Fatigue. As your body works hard to support your growing baby, you may feel more tired than usual. Frequent urination. Your baby's position may put pressure on your bladder, causing you to urinate more frequently. Tips for a healthy pregnancy. Eat a healthy diet. Make sure to eat a well-balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Stay hydrated. Drink plenty of water and other fluids throughout the day to stay hydrated. Exercise. Gentle exercise, such as walking or swimming, can help relieve some of your pregnancy symptoms and prepare your body for labor. Attend prenatal appointments. Regular prenatal appointments with your healthcare provider are essential to monitor your baby's growth and ensure a healthy pregnancy. Take childbirth classes. Childbirth classes can help prepare you and your partner for labor and delivery. Conclusion. At week 31 of pregnancy, your baby is continuing to grow and develop rapidly. You may experience some new symptoms or the worsening of old ones, but there are steps you can take to stay healthy and comfortable during this time. Remember to eat a healthy diet, stay hydrated, exercise, get plenty of rest, attend prenatal appointments, take childbirth classes, and practice relaxation techniques. With these tips, you can have a healthy and happy pregnancy. Thanks for tuning in, and we'll see you next time. Stone in your pregnancy.
Baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks host. You may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember 10 techniques to ease any discomfort. Fatigue and difficulty sleeping. Host. Fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and lows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal
fully developed, and they are practicing breathing movements in preparation for birth. Body fat. Your baby is continuing to gain weight and develop body fat, which will help regulate their body temperature after birth. Sleep and wake cycles. Your baby may start to have regular sleep and wake cycles, which can help prepare them for life outside the womb. Head down position. Most babies will move into the head down position in preparation for delivery. Overall, pregnancy at 34 weeks is an exciting and important time as you prepare for the birth of your baby. Remember to take care of yourself and stay in touch with your doctor as you get closer to your due date. Thanks for watching, and I'll see you in the next video. "35 weeks pregnancy. Baby development and symptoms." Welcome back to our channel, where we explore the incredible journey of pregnancy. Today, we're going to dive into the exciting world of 35 weeks of pregnancy. At this stage, your baby is rapidly developing, and you may be experiencing various symptoms. So let's get started. Baby's development. Your baby now weighs around 5.5 to 6 pounds and measures about 18 inches from head to toe. The baby's organs and systems are nearly fully developed, and the skin is becoming smoother as the fat layers continue to fill out. Your baby's rapidly growing, and the nervous system is maturing. The baby's bones are fully formed but are still flexible to ease the birthing process. Symptoms you may experience. You may experience more frequent and intense practice contractions, which can help prepare your body for labor. Shortness of breath. As your uterus expands, it pushes against your diaphragm, making it harder to take deep vaginal discharge. Itching, burning, or frequent urination. The baby's position and size may put pressure on your bladder, causing the need to urinate sleeping. Finding it brought to your healthcare provider or a lactation any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds, 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember to stay hydrated and practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color,
consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins, host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking regular walks can help alleviate these symptoms. Emotional changes, host. Lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining. Thank you for watching, and we'll see you. Hello, hospital bag and birth plan. Now is the time to make sure your hospital bag is packed and ready to go. Include essentials like comfortable clothes, toiletries, and items for the baby. It's also a good idea to have your birth plan written out and discuss it with your healthcare provider. However, keep in mind that labor and delivery can be unpredictable, so be flexible with your expectations. That wraps up our discussion on the development and symptoms during 38 weeks of pregnancy. We hope you found this information helpful and informative. Don't forget to subscribe to our channel for more pregnancy and baby-related content. As always, take care of yourself and your little one. See you next time. Welcome to our YouTube channel, where today, we'll take you on a fascinating magical moment of conception to the incredible birth of a new life. We'll explore the various stages, milestones, and changes that occur during this remarkable. Dive right in. Week 1, Conception officially becomes a fetus. It's about the size of a raspberry and can start moving its limbs. During weeks 9 to 12, the fetus undergoes rapid growth. Its sex organs start to form, and it can make small movements, though the mother cannot feel them yet. Week 13, Trimester 1 ends. Host. At week 13, the first trimester comes to an end. The fetus is now about the size of a lemon, and its tiny fingerprints are forming. Week 14-16, Developing senses. Host. In weeks 14 to 16, the fetus's senses begin to develop. It can now hear sounds from the outside world and may even suck its thumb. Week 17-20, Movement sensation. Host. During weeks 17 to 20, the mother starts to feel the baby's movements. The fetus's skin becomes covered with vernix, a protective waxy substance. Week 21-24, Viability. Host. At weeks 21 to 24, the fetus reaches the age of viability, where it has a chance of survival outside the womb with medical assistance. Week 25-28, Rapid brain development. Host. During weeks 25 to 28, the baby's brain undergoes significant development. The eyes open and close, and the fetus has distinct sleep-wake cycles. Week 29-32, Developing immune system. Host. In weeks 29 to 32, the baby's immune system strengthens as it receives antibodies from the mother. Week 33-36, Lung development. Host. At weeks 33 to 36, the baby's lungs mature, and it assumes a head-down position in preparation for birth. Week 37, Full term. Host. Congratulations! At week 37, the baby is considered full term, and it's now ready to be born. Week 38-39, Final weeks. Host. In the final weeks, the baby drops lower into the pelvis, relieving pressure on the mother's diaphragm and making breathing easier. Birth. Host. And now, after an incredible journey of 39 weeks, it's time for the most momentous event, the birth of the baby. It's a miraculous and emotional experience that marks the beginning of a new chapter in the lives of both the parents and the newborn. Conclusion. Host. Pregnancy and baby development encompass an awe-inspiring process that showcases the wonders of life. From
Weeks 1-4. Week 1, conception occurs, and the journey begins. Week 2, the fertilized egg travels down the fallopian tube. Week 3, implantation takes place, and the embryo starts to form. Week 4, the neural tube, which will become the brain and spinal cord. Weeks 5 to 8. Week 5. The heart begins to beat, and limb buds form. Week 6. Facial features and the heart's chambers start to develop. Week 7. Baby's arms and legs grow longer, and facial features become more defined. Week 8. The embryo is now called a fetus, and organs continue to form. Weeks 9 to 12. Week 9. Fingers and toes start to develop, and the fetus can make spontaneous movements. Week 10. The baby's facial expressions begin, and the vital organs are functioning. Week 11. The fetus is about the size of a lime, and gender can be determined. Week 12. Baby's reflexes develop, and the risk of miscarriage decreases significantly. Weeks 13 to 16. Week 13. Baby's vocal cords begin to form, and the digestive system develops. Week 14. Facial features become more distinct, and the baby can now squint and frown. Week 15. The baby starts producing urine, and the skin becomes more transparent. Week 16. Baby's movements become more coordinated, and the bones harden. Week 17, 20, week 17, the fetus can hear external sounds, and the umbilical cord thickens. Week 18, baby's taste buds form, and the nervous system continues to mature. Week 19, vernix caseosa, a protective layer, covers the skin. Week 20, halfway there. The baby can suck its thumb, and the mother may feel the first movements. Weeks 21-24. Week 21, eyebrows and eyelashes develop, and the baby can taste the amniotic fluid. Week 22, the fetus is now responsive to light and dark. Week 23, rapid brain growth occurs, and lungs continue to develop. Week 24, the baby's viability outside the womb increases, though it's still premature. Weeks 25-28. Week 25. Baby's kicks become stronger, and lungs are maturing further. Week 26. Eyes open, and the baby responds to external stimuli. Week 27. Rapid weight gain begins, and the nervous system is fine-tuning. Week 28. The third trimester begins, and the baby's survival chances significantly improve. Weeks 29-32. Week 29. The baby's bones fully harden, and the kicks and movements may be visible. Week 30. Lungs are almost fully developed, and the baby practices breathing. Week 31. The baby's immune system strengthens. Week 32. Baby's toenails and fingernails grow, and the head settles into the pelvis. Weeks 33-36. Week 33. The baby's bones are fully formed, and the nervous system is maturing. Week 34. The baby practices blinking, and the amniotic fluid decreases as the baby grows. Week 35. The baby's liver and kidneys are fully functional. Week 36. The baby is gaining weight rapidly, preparing for birth. Weeks 37-40. Week 37. Full term. The baby's organs are ready for life outside the womb. Week 38. The baby's immune system gets a boost from the mother. Week 39-40. The baby may arrive any time now. The mother might experience signs of labor, and it's time to prepare for the exciting moment of birth. Conclusion. As the 40-week journey concludes, we celebrate the incredible process of pregnancy, from conception to the miraculous moment of welcoming a new life into the world. Stay tuned for more parenting tips and guidance on our channel.
Hello and welcome to our video about the 21 weeks of pregnancy symptom and baby development, changes that are happening in your baby's development, and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, and you may develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. To elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion. So, there you have it, week 22 of pregnancy. As your pregnancy progresses, be sure to take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. In this video, we will be discussing the 23. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving. You may start to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23rd week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's pregnancy update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. Your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. Your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's... Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga,
measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Trouble sleeping. As your baby becomes more active, you may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your healthcare provider. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, and sometimes, uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions. Join us next time on The Incredible Journey as we continue to explore the miracle of pregnancy and baby development.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider. That's it for this week's video on pregnancy symptoms and baby development. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the third trimester, they will be able to hiccup. So, what can you expect during the rest of the third trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the third trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the third trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class, which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29th week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello, and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly,
and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you diet that includes plenty of fruits, vegetables, and lean protein. Avoid foods that are high in sugar or fat. Stay active. Regular exercise can help you feel better and reduce stress. Walking, swimming, and prenatal yoga are all good options. Conclusion. At 30 weeks of pregnancy, the baby is growing rapidly, and the mother's body is going through many changes. It's essential to take care of yourself and attend regular prenatal checkups to ensure both you and your baby stay healthy. Remember to eat a healthy diet, stay active, get plenty of rest, and drink plenty of water. Thank you for watching, and we wish you a healthy and happy pregnancy.
"11 weeks pregnant, your baby's development." From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients, and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving, and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth. Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, Light spotting. See your doctor if you get bleeding in pregnancy. Cramping, a bit like period pains. Darkened skin on your face or brown patches. This is known as chloasma or the mask of pregnancy. Greasier, spotty skin. Thicker and shinier hair. Bloating and the feeling of being bloated.
Weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are still too early to know whether you're having a boy or a girl. At 14 weeks, rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 is the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy heart, make your gums more sensitive to the bacteria in plaque. Round ligament pain. On either side of your uterus, you have two ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OBGYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks, but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during the have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina, and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length.
The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin. It's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
17 weeks baby development. How big is your baby at 17 weeks pregnant? The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and an inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. The kidneys are wallow some urine, which is sterile, in the amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might start to feel your baby move now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more. Out music. The baby is now able to move in a more growing rapidly and developing new skills. Although it may be difficult to imagine, you're like a newborn, as you'll be able to feel more and more of its movements inside your womb. And see, you will be able to feel your baby's kicks, punches. Video on 19 weeks of pregnancy. Conclusion, at 19 weeks pregnant, your baby is growing and developing rapidly, and you may be experiencing some common symptoms like that. It's important to continue taking care of yourself by eating a healthy diet, staying active, and getting plenty of rest. Remember to schedule your next prenatal appointment with your healthcare provider and ask any questions or concerns you may have. Thank you for watching, and we'll see you in the next video.
Hello and welcome to this video on 20 weeks of pregnancy symptoms and baby development. At 20 weeks, you're halfway through your pregnancy and your baby has reached an exciting milestone. So, stage. Firstly, at this stage, your baby is about the size of a banana, weighing around 10 ounces and measuring around 6.5 inches in length. They are now fully formed and all their major organs are in place. Your baby's skin is still thin and translucent, but they are beginning to develop a layer of fat to help regulate their body temperature. One of the most exciting developments during this stage is that you can now feel your baby's movements. Your baby is becoming more active and you might feel them kicking or moving around. As your baby grows, their movements will become more defined and frequent. Now, let's move on to the symptoms you might experience at 20 weeks of pregnancy. Firstly, many women experience increased appetite during this stage. 2. You may feel it often. This is because your body needs more energy to support your growing baby. Another symptom you may experience is heartburn or indigestion. As your uterus expands, it puts pressure on your stomach, which can cause acid reflux. To reduce this, try eating smaller, more frequent meals and avoid spicy or acidic foods. You may also experience some mild swelling in your feet and ankles. This is because your body is retaining more water during pregnancy. To reduce swelling, try resting with your feet elevated and avoid standing or sitting for long periods of time. One of the most common symptoms of pregnancy at 20 weeks is back pain. As your uterus grows,
it puts pressure on your back and can cause discomfort. To reduce back pain, try using a pregnancy pillow to support your body while sleeping and avoid lifting heavy objects. Finally, you may experience some mood swings or heightened emotions during this stage. This is normal as your body is going through many changes, and it's important to take care of your emotional well-being as well as your physical health. In terms of prenatal care, it's important to attend all your scheduled appointments with your healthcare provider. At 20 weeks, you will have an ultrasound to check on your baby's growth and development. This is also when you may find out the sex of your baby if you choose to. In summary, at 20 weeks of pregnancy, your baby is fully formed and developing rapidly. You may experience symptoms such as increasing
Body is preparing for PON. How is pregnancy calculated? Calculating the day your baby begins and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates. What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11 different in a week. 3 weeks, pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought. Or you may even be 3 weeks pregnant with twins. That's because twin moms see hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore, and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks, pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later. Before you start eating for two, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation comes a rise in the pregnancy hormone HCG. There may be enough HCG to detect with a sensitive early home pregnancy test. First, your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.2 millimeters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. They're insides that will develop into your baby and wait about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy, such as breast tenderness. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. Sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy.
9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spot, abdominal or pelvic cramps. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubal pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Moms and this week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract.
To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some weeks, but it should be light, not even however. Every pregnancy and every woman is different. For example, some women never experience morning sickness will continue long after birth. As the week progresses, lungs are also developing. Facial features, our little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and your baby's weight. If you have a prenatal checkup scheduled for this week or have an opportunity to see and hear something amazing, a heartbeat isn't in your healthcare provider's plans quite yet. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body. At the pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavy or bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks become a long way, and soon, growth will speed right up. Your little one is about the size of a raspberry this week, just 0.5 to 0.6 inch long, crown to rump. Mom's body. By the time you're 8 weeks, boobs may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first times you may have been experiencing. 8 weeks pregnant, your symptoms. You may be dealing with nausea and even vomiting right about now. The good news. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too. 9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester, Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. Morning sickness by now, you could be one of them. But if you do get meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, as you can during the day, if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormones where your baby is born. "10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant.
Health over 50. What not to include in your daily diet. 1. Excessive sugars. Minimize intake of sugary foods to maintain stable blood sugar levels. 2. Processed foods. Cut back on highly processed foods that often contain unhealthy additives. 3. High sodium foods. Reduce salt intake to maintain healthy blood pressure levels. 4. Saturated fats. Limit consumption of saturated fats to support heart health. 5. Trans fats. Avoid trans fats found in many fried and commercially baked goods. 6. Carbonated drinks. Opt for water over sugary or carbonated beverages to stay hydrated. 7. Red and processed meats. Reduce red and processed meat intake for better heart health. 8. Alcohol. Limit alcohol consumption to promote liver and overall health. 9. Caffeine. Monitor caffeine intake, especially later in the day, to support sleep. 10. Large meals before bed. Avoid heavy meals before bedtime for better digestion. 11. Excessive dairy.
Moderate dairy intake, especially if lactose intolerant. 12. Empty calorie snacks. Minimize snacks with empty calories. Opt for nutrient-dense options. 13. Fried foods. Cut down on fried foods to reduce the intake of unhealthy fats. 14. Artificial sweeteners. Be cautious with artificial sweeteners. Opt for natural alternatives. 15. High glycemic index foods. Choose low GI foods to manage blood sugar levels. 16. Low fiber foods. Prioritize fiber-rich foods for digestive health. 17. Overly spicy foods. Be mindful of overly spicy foods, as they may aggravate certain conditions. 18. Excessive dairy. Moderate dairy intake, especially if lactose intolerant. 19. Fast food. Minimize fast food consumption due to high levels of unhealthy ingredients. 20. Empty calorie snacks. Opt for nutrient-dense snacks to meet nutritional needs. Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Point 1. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of Listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw sprouts. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for the health of you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider for personalized advice. If you found this information helpful, don't forget to like, subscribe, and share. Until next time, take care. 10 Best Foods for Boosting Fertility in Women. Introduction. Greet your audience and introduce the topic. Mention the importance of nutrition in fertility. Point 1. Fruits and vegetables. Highlight the benefits of vitamins, minerals, and antioxidants. Provide examples of fertility-friendly fruits and vegetables. Point 2. Leafy greens. Emphasize the role of folate in reproductive health. Recommend specific leafy greens like spinach and kale. Point 3. Whole grains. Discuss the benefits of complex carbohydrates and essential nutrients. Suggest whole grains such as quinoa, brown rice, and oats. Point 4. Lean proteins. Explain the importance of protein without excess saturated fats. Recommend sources like poultry, fish, and plant-based proteins. Point 5. Nuts and seeds. Highlight the nutritional value of healthy fats, protein, and minerals. Name specific nuts and seeds beneficial for fertility. Point 6. Fatty fish. Discuss the role of omega-3 fatty acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video. Title: Managing Pregnancy Weight Gain 20 Tips for a Healthy Journey. 1. Introduction. Welcome viewers and address the importance of managing weight during pregnancy. 2. Consult your healthcare provider. Emphasize the significance of consulting with a healthcare professional before making any changes. 3. Understand healthy weight gain range. Explain the recommended weight gain range based on pre-pregnancy BMI. 4. Balanced nutrition. Stress the importance of a well-balanced diet, including fruits, vegetables, whole grains, and lean proteins. 5. Stay hydrated. Remind viewers to stay hydrated by drinking plenty of water throughout the day. 6. Regular exercise. Highlight safe exercises during pregnancy, such as walking, swimming, and prenatal yoga. 7. Monitor portion sizes. Discuss the significance of portion control to avoid overeating. 8. Choose nutrient-dense foods. Encourage the consumption of nutrient-dense foods for both the baby's and mother's health. 9. Limit added sugars and processed foods. Advise viewers to minimize the intake of added sugars and processed foods for a healthier pregnancy. 10. Include healthy snacks. Suggest healthy snack options to curb cravings without compromising nutrition. 11. Listen to your body. Encourage women to pay attention to hunger and fullness cues. 12. Weight monitoring. Discuss the importance of regular weight monitoring under the guidance of healthcare professionals. 13. Manage stress. Address the impact of stress on weight and provide tips for stress management during pregnancy. 14. Adequate sleep. Emphasize the importance of sufficient sleep for overall well-being. 15. Support system N. Highlight the role of a supportive network during pregnancy. 16. Educate gestational diabetes. Discuss the link between gestational diabetes and weight and ways to manage it. 17. Limit caffeine intake. Remind viewers to moderate their caffeine intake during pregnancy. 18. Healthy cooking methods. Encourage the use of healthy cooking methods like grilling, steaming, or baking. 19. Postpartum planning. Discuss the importance of postpartum planning for a smooth transition and healthy lifestyle continuation. 20. Celebrate non-scale victories. Encourage celebrating accomplishments beyond the scale, focusing on overall health and well-being. Conclusion. Summarize the key points and express encouragement for a healthy pregnancy journey. Remember to tailor the script to your audience and consult with healthcare professionals for personalized advice. Title: Understanding Pregnancy Complications, Signs and Symptoms. 1. Introduction. Welcome viewers to our channel. Today, we'll discuss crucial information about recognizing pregnancy complications. 2. Common pregnancy complications. Highlight common complications like preeclampsia, gestational diabetes, and placenta previa. Briefly explain each complication and its potential impact on both the mother and the baby. 3. Signs and symptoms. Discuss general signs such as persistent pain, swelling, or sudden weight gain. Break down specific symptoms associated with different complications. 4. Preeclampsia. Elaborate on high blood pressure and protein in urine as key indicators. Emphasize the importance of regular prenatal checkups for early detection. 5. Gestational diabetes. Explain how elevated blood sugar levels during pregnancy can pose risks. Encourage awareness of symptoms like increased thirst and frequent urination. 6. Placenta previa. Describe the condition where the placenta covers the cervix. Emphasize the need for immediate medical attention if there's vaginal bleeding. 7. Preterm labor. Discuss warning signs like regular contractions before 37 weeks. Encourage seeking medical help if contractions persist. 8. Ectopic pregnancy. Explain the risks associated with a fertilized egg implanting outside the uterus. Stress the importance of recognizing symptoms like severe abdominal pain and shoulder pain. 9. Infections. Briefly touch on common infections during pregnancy. Advocate for good hygiene and regular prenatal care to prevent infections. 10. Hemorrhage. Explain the risks of excessive bleeding during pregnancy. Emphasize the urgency of seeking medical help for any unexplained bleeding. 11. Multiple pregnancies. Discuss potential complications in twin or multiple pregnancies. Highlight the importance of specialized care and monitoring. 12. Importance of regular checkups. Stress the significance of prenatal appointments in detecting and addressing complications early. Encourage open communication with healthcare providers. 13. Self-monitoring. Advise pregnant individuals to be attentive to their bodies. Encourage reporting any unusual symptoms promptly to healthcare professionals. 14. Support system. Emphasize the role of emotional support during pregnancy. Highlight the importance of involving partners, family, and friends. 15. Emergency plan. Discuss the importance of having an emergency plan in case complications arise. Encourage pregnant individuals to know emergency contact numbers and the nearest medical facilities. 16. Nutrition and lifestyle. Briefly touch on the significance of a healthy diet and lifestyle. Recommend regular exercise under professional guidance. 17. Medical interventions.
Discuss potential medical interventions for managing complications. Stress that early intervention can improve outcomes. 18. Case studies, testimonials. Share real-life experiences of individuals who recognized and addressed complications. Offer hope and inspiration to viewers facing similar situations. 19. Conclusion. Summarize key points discussed. Reiterate the importance of awareness, regular checkups, and prompt medical attention. 20. Closing. Thank viewers for watching. Encourage them to subscribe for more informative content. Remind them that early detection and proper management of complications can lead to healthier pregnancies. Title: Understanding Anemia in Pregnancy, Symptoms and Deficiency. 1. Introduction. Greetings everyone. Welcome back to our channel. Today we'll be discussing a crucial topic for expecting mothers: anemia during pregnancy. 2. Definition of anemia. Let's start by understanding what anemia is. Anemia is a condition characterized by a lack of healthy red blood cells, leading to reduced oxygen flow to the body's tissues. 3. Prevalence in pregnancy. During pregnancy, the prevalence of anemia increases due to the body's increased blood volume and the demands of the growing baby. 4. Importance of iron. One common cause of anemia in pregnancy is iron deficiency. Iron is vital for the production of hemoglobin, the protein in red blood cells that carries oxygen. 5. Symptoms of anemia. Now, let's delve into the symptoms. Fatigue and weakness are hallmark signs of anemia, often exacerbated during pregnancy due to the added strain on the body. 6. Pale skin and nails. Anemic individuals may experience paleness of the skin and nails as reduced hemoglobin levels affect the skin's color. 7. Shortness of breath. Shortness of breath, even with minimal exertion, can be a notable symptom as the body struggles to transport enough oxygen. 8. Dizziness and lightheadedness. Anemia can lead to dizziness and lightheadedness, making it essential for pregnant individuals to be aware of these signs. 9. Rapid heartbeat. A rapid or irregular heartbeat is another indicator of anemia, reflecting the heart's attempt to compensate for reduced oxygen carrying capacity. 10. Cold hands and feet. Poor circulation due to anemia may result in cold extremities, such as hands and feet. 11. Cognitive impairment. Cognitive impairment, including difficulty concentrating and memory issues, can arise due to insufficient oxygen reaching the brain. 12. Cravings for non-food items. A unique symptom called pica may occur, leading to cravings for non-food items like ice or dirt, often associated with iron deficiency. 13. Risk factors. Certain factors increase the risk of anemia in pregnancy, such as inadequate iron intake, multiple pregnancies, and a history of anemia. 14. Importance of prenatal vitamins. Prenatal vitamins containing iron are commonly recommended to prevent and treat anemia in pregnancy. Always consult with your healthcare provider. 15. Dietary recommendations. Incorporating iron-rich foods like leafy greens, lean meats, and legumes into your diet is crucial for maintaining healthy iron levels. 16. Routine blood tests. Regular blood tests during prenatal care help monitor hemoglobin levels, enabling early detection and intervention. 17. Treatment options. Treatment may involve iron supplements prescribed by your healthcare provider, alongside dietary adjustments. 18. Follow-up and monitoring. Regular follow-up appointments and monitoring ensure that the chosen treatment is effectively addressing the anemia. 19. Conclusion. In conclusion, understanding anemia's symptoms and causes during pregnancy is vital for ensuring a healthy journey for both the mother and the baby. 20. Call to action. If you found this video helpful, don't forget to like, share, and subscribe. And as always, consult your healthcare provider for personalized advice. Thanks for tuning in. Title: Relieve back pain during pregnancy. 20 practical tips for moms-to-be. 1. Introduction. Greet your viewers and mention the common issue of back pain during pregnancy. Highlight the importance of addressing and relieving back pain for a more comfortable pregnancy. 2. Consult your healthcare provider. Emphasize the importance of consulting with a healthcare professional before trying any remedies. 3. Maintain good posture. Explain how maintaining proper posture can alleviate strain on the back. 4. Gentle prenatal exercises. Suggest safe and gentle exercises to strengthen the core and back muscles. 5. Pelvic tilt exercises. Demonstrate pelvic tilt exercises for strengthening and flexibility. 6. Prenatal yoga. Discuss the benefits of prenatal yoga in relieving back pain. 7. Warm up before exercise. Emphasize the importance of warming up before engaging in any physical activity. 8. Supportive footwear. Recommend comfortable and supportive footwear to reduce stress on the spine. 9. Use pregnancy pillows. Explain how using pregnancy pillows can provide extra support during sleep. 10. Regular breaks. Encourage taking short breaks to avoid prolonged sitting or standing. 11. Hot-cold therapy. Discuss the use of hot or cold packs for temporary relief. 12. Massage and acupressory. Highlight the benefits of massage or acupressure for relaxation and pain relief. 13. Hydrate and maintain a healthy diet. Emphasize the importance of staying hydrated and consuming a balanced diet for overall health. 14. Avoid high heels. Advise against wearing high heels as they can contribute to back discomfort. 15. Incorporate lumbar support. Suggest using a lumbar support pillow or cushion when sitting for extended periods. 16. Stay active. Encourage regular, low-impact activities to keep the body moving. 17. Swimming. Mention the benefits of swimming for buoyancy and reduce strain on the back. 18. Breathing exercises. Introduce deep breathing exercises to promote relaxation and reduce tension. 19. Consider prenatal massage therapy. Discuss the potential benefits of professional prenatal massage for back pain relief. 20. Conclusion. Summarize key points and remind viewers to consult with their healthcare provider before trying any new methods. Remember to speak clearly, use engaging visuals, and make it easy for viewers to follow along with the practical tips you're providing.
Natural remedies for pregnancy morning sickness. 20 effective tips. 1. Introduction. Welcome to our channel. Today we'll explore 20 natural remedies to help alleviate morning sickness during pregnancy. 2. Stay hydrated. Start your day with a glass of water to stay hydrated and combat nausea. 3. Ginger tea. Sip on ginger tea throughout the day. It's known for its anti-nausea properties. 4. Small, frequent meals. Opt for smaller, more frequent meals to prevent an empty stomach triggering nausea. 5. Crackers or dry toast. Keep crackers or dry toast by your bedside and munch on them before getting out of bed. 6. Vitamin B6 supplements. Consider taking vitamin B6 supplements under medical guidance to ease morning sickness. 7. Peppermint aromatherapy. Inhale peppermint essential oil or use peppermint aromatherapy to soothe nausea. 8. Acupressure wristbands. Talks. Try acupressure wristbands, which target specific pressure points to alleviate morning sickness. 9. Lemon water. Squeeze fresh lemon into your water. The scent and taste may help calm your stomach. 10. Avoid strong odors. Steer clear of strong odors, as heightened senses during pregnancy can trigger nausea. 11. Protein-rich snacks. Snack on protein-rich foods like nuts or yogurt to stabilize blood sugar levels. 12. Chamomile tea. Enjoy a cup of chamomile tea. Its calming properties can ease nausea and promote relaxation. 13. Minty foods. Include minty foods like peppermint candies or gum to help soothe your stomach. 14. Lavender oil. Diffuse lavender oil or add a few drops to a cotton ball for a calming effect. 15. Cold compress. Apply a cold compress to your forehead or neck to alleviate nausea symptoms. 16. Stay active. Engage in light exercises like walking to promote overall well-being and reduce nausea. 17. Papaya enzymes. Consider papaya enzyme supplements to aid digestion and minimize nausea. 18. Yoga and deep breathing. Practice gentle yoga and deep breathing exercises to relax your body and mind. 19. Keep a food diary. Monitor your diet and identify triggers by keeping a food diary. 20. Consult your healthcare provider. Always consult your healthcare provider before trying new remedies to ensure they're safe for you and your baby. Remember, every pregnancy is unique, and what works for one person may not work for another. If symptoms persist, seek professional advice. Don't forget to like, share, and subscribe for more helpful content. Title: 40 Weeks of Pregnancy, Symptoms, and Baby Development. Introduction. Welcome to our comprehensive guide on the incredible journey of pregnancy, spanning 40 weeks of symptoms and baby development. Weeks 1-4. Week 1, conception occurs, and the journey begins. Week 2, the fertilized egg travels down the fallopian tube. Week 3, implantation takes place, and the embryo starts to form. Week 4, the embryo develops the neural tube, which will become the brain and spinal cord. Weeks 5-8. Week 5. The heart begins to beat and limb buds form. Week 6. Facial features and the heart's chambers start to develop. Week 7. Baby's arms and legs grow longer and facial features become more defined. Week 8. The embryo is now called a fetus and organs continue to form. Weeks 9-12. Week 9. Fingers and toes start to develop, and the fetus can make spontaneous movements. Week 10. The baby's facial expressions begin, and the vital organs are functioning. Week 11. The fetus is about the size of a lime, and gender can be determined. Week 12. Baby's reflexes develop, and the risk of miscarriage decreases significantly. Weeks 13-16. Week 13. Baby's vocal cords begin to form, and the digestive system develops. Week 14, facial features become more distinct, and the baby can now squint and frown. Week 15, the baby starts producing urine and the skin becomes more transparent. Week 16, baby's movements become more coordinated and the bones harden. Week 17-20, week 17, the fetus can hear external sounds and the umbilical cord thickens. Week 18, baby's taste buds form and the nervous system continues to mature. Week 19. Vernix caseosa, a protective layer, covers the skin. Week 20. Halfway there. The baby can suck its thumb, and the mother may feel the first movements. Weeks 21-24. Week 21. Eyebrows and eyelashes develop, and the baby can taste the amniotic fluid. Week 22. The fetus is now responsive to light and dark. Week 23. Rapid brain growth occurs, and lungs continue to develop. Week 24, the baby's viability outside the womb increases, though it's still premature. Weeks 25-28, week 25. Baby's kicks become stronger and lungs are maturing further. Week 26, eyes open, and the baby responds to external stimuli. Week 27, rapid weight gain begins, and the nervous system is fine-tuning. Week 28, the third trimester begins, and the baby's survival chances significantly improve. Weeks 29 to 32, week 29, the baby's bones fully harden, and the kicks and movements may be visible. Week 30, lungs are almost fully developed, and the baby practices breathing. Week 31, the baby's immune system strengthens. Week 32, baby's toenails and fingernails grow, and the head settles into the pelvis. Weeks 33-36, week 33, the baby's bones are fully formed, and the nervous system is maturing. Week 34, the baby practices blinking, and the amniotic fluid decreases as the baby grows. Week 35, the baby's liver and kidneys are fully functional. Week 36, the baby is gaining weight rapidly, preparing for birth. Weeks 37-40, week 37, full term, the baby's organs are ready for life outside the womb. Week 38, the baby's immune system gets a boost from the mother. Week 39-40, the baby may arrive anytime now. The mother might experience signs of labor, and it's time to prepare for the exciting moment of birth. Conclusion. As the 40-week journey concludes, we celebrate the incredible process of pregnancy, from conception to the miraculous moment of welcoming a new life into the world. Stay tuned for more parenting tips and guidance on our channel. Title: Journey into Motherhood, the Labor and Delivery Process. 1. Introduction. Greet viewers and set the tone for an informative journey. Briefly explain the significance of understanding the labor and delivery process. 2. Early signs of labor. Discuss common early signs, such as contractions and the release of the mucus plug. Emphasize the importance of timing contractions. 3. Stages of labor. Break down labor into 3 stages: early, active, and transitional. Explain what happens during each stage and how the body prepares for childbirth. 4. Cervical dilation. Clarify the concept of cervical dilation and its role in the progression of labor. Discuss how healthcare professionals monitor dilation. 5. Fetal positioning. Describe the optimal position for the baby during labor. Address potential challenges with fetal positioning and how they are managed. 6. Pain management options. Explore various pain relief methods, including medical and non-medical options. Highlight the importance of birth plans and communicating preferences. 7. Medical interventions. Discuss common interventions like inductions, epidurals, and assisted deliveries. Explain when these interventions may be recommended and their potential benefits. 8. Labor and delivery environment. Detail the typical hospital or birthing center setup. Mention the role of healthcare professionals during labor. 9. Breathing techniques. Introduce breathing exercises to help manage pain and stress during contractions. Offer practical tips for practicing effective breathing. 10. Partner's role. Discuss how partners can actively support the birthing person. Encourage communication and understanding between partners. 11. Complications and emergency situations. Address potential complications during labor. Explain emergency procedures and the importance of medical professionals. 12. Delivery positions. Explore different birthing positions, such as upright, side-lying, or hands and knees. Highlight the benefits of each position. 13. Crowning and delivery. Explain the crowning phase and the actual delivery of the baby. Discuss the birthing person's efforts and the guidance of healthcare professionals. 14. Umbilical cord clamping. Clarify the timing and significance of umbilical cord clamping. Discuss the options for delayed cord clamping. 15. Delivery of the placenta. Detail the process of delivering the placenta. Highlight the importance of monitoring for any complications. 16. Postpartum care. Discuss immediate postpartum care for both the birthing person and the baby. Address potential challenges and the role of healthcare providers. 17. Skin-to-skin contact. Emphasize the benefits of skin-to-skin contact immediately after birth. Encourage bonding and breastfeeding. 18. Newborn procedures. Outline common procedures performed on newborns after delivery. Discuss the importance of informed consent. 19. Emotional and physical recovery. Touch on the emotional aspects of postpartum recovery. Offer tips for physical recovery and self-care. 20. Conclusion. Summarize the key points of the labor and delivery process. Encourage viewers to share their experiences and seek professional guidance. Title: Top 20 Tips for Boosting Fertility and Conceiving Quickly in Your 20s to 30s. 1. Maintain a healthy lifestyle. Adopt a balanced diet, regular exercise, and adequate sleep to support overall health and fertility. 2. Know your menstrual cycle. Understand your menstrual cycle and identify your fertile days for optimized timing. 3. Regular exercise. Engage in moderate exercise to enhance overall well-being and fertility. 4. Manage stress levels. Practice stress reduction techniques like yoga or meditation to create a fertility-friendly environment. 5. Limit caffeine and alcohol. Reduce consumption of caffeine and alcohol, as excessive amounts can impact fertility. 6. Quit smoking. Smoking can negatively affect fertility, so quitting is essential for those trying to conceive. 7. Maintain a healthy weight. Both underweight and overweight conditions can impact fertility, so strive for a healthy weight range. 8. Stay hydrated. Drink plenty of water to maintain optimal bodily functions and support fertility. 9. Regular sexual activity. Have regular and unprotected intercourse, especially during your fertile window. 10. Prenatal vitamins. Begin taking prenatal vitamins with folic acid to support reproductive health. 11. Limit exposure to harmful chemicals. Reduce exposure to environmental toxins and chemicals that may interfere with fertility. 12. Balanced diet. Consume a diet rich in vitamins, minerals, and antioxidants to boost reproductive health. 13. Regular health checkups. Schedule regular checkups to address any underlying health issues that may impact fertility. 14. Fertility awareness apps. Utilize fertility tracking apps to monitor and predict your fertile days accurately. 15. Sexual positions. Experiment with different sexual positions that may enhance sperm reach and increase chances of conception. 16. Limit hot baths, showers. Excessive heat can affect sperm quality, so avoid hot baths and showers. 17. Stay informed. Educate yourself about fertility and reproductive health to make informed decisions. 18. Open communication. Maintain open communication with your partner about your family planning goals and expectations. 19. Lubricants. Choose fertility-friendly lubricants, or try alternative methods to ensure sperm viability. 20. Seek professional advice. If conception doesn't happen within a reasonable time frame, consult a fertility specialist for guidance and support. Remember, everyone's journey is unique, and it's crucial to be patient and allow time for nature to take its course. Title: Tips for Fast Conception in Women Aged 30-40. Boost your fertility naturally. 1. Understand your menstrual cycle. Track your ovulation to identify your fertile window. 2. Maintain a healthy weight. Achieving a healthy BMI can positively impact fertility. 3. Balanced diet. Consume a nutrient-rich diet with plenty of fruits, vegetables, and whole grains. 4. Stay hydrated. Drink enough water to support overall reproductive health. 5. Regular exercise. Engage in moderate physical activity to enhance fertility. 6. Limit caffeine and alcohol. Excessive caffeine and alcohol intake may affect fertility, so moderate consumption is advisable. 7. Quit smoking. Smoking can decrease fertility, so quitting is essential for conception. 8. Manage stress. Practice stress-reducing activities such as yoga, meditation, or deep breathing. 9. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 10. Supplement wisely. Consider taking prenatal vitamins and other supplements like folic acid. 11. Avoid harmful chemicals. Minimize exposure to toxins and chemicals that could impact fertility. 12. Know your fertility window. Be aware of the days you are most fertile during your menstrual cycle. 13. Regular checkups. Schedule regular visits with your healthcare provider for fertility assessments. 14. Seek professional advice. Consult with a fertility specialist if you encounter difficulties conceiving. 15. Embrace a positive mindset. Cultivate a positive outlook and stay optimistic during the conception journey. 16. Communication with partner. Openly discuss your plans and maintain good communication with your partner. 17. Sexual timing. Be intimate during your fertile window for better chances of conception. 18. Avoid lubricants. Some lubricants can hinder sperm movement, so choose fertility-friendly alternatives. 19. Educate yourself. Stay informed about fertility and reproductive health to make informed decisions. 20. Patience and persistence. Understand that conception might take time. Stay persistent and patient throughout the process. Remember, individual factors may vary, and it's crucial to consult with a healthcare professional for personalized advice. Title: Effective PCOS Treatment, 20 Key Steps to Manage Polycystic Ovary Syndrome. 1. Introduction. Greet your viewers and provide a brief overview of PCOS. Mention the importance of early diagnosis and management. 2. Understanding PCOS. Explain what PCOS is and its impact on women's health. Highlight common symptoms such as irregular periods, acne, and weight gain. 3. Seek professional help. Emphasize the importance of consulting a healthcare professional for a proper diagnosis. Encourage viewers to find a healthcare provider experienced in managing PCOS. 4. Lifestyle modifications. Discuss the role of diet and exercise in managing PCOS symptoms. Suggest a balanced diet with emphasis on whole foods and regular physical activity. 5. Weight management. Address the link between PCOS and weight gain. Provide tips on healthy weight loss strategies, if applicable. 6. Medication options. Briefly explain common medications prescribed for PCOS, such as birth control pills and anti-androgens. Highlight the importance of medication adherence. 7. Nutritional supplements. Discuss supplements like inositol and vitamin D that may benefit women with PCOS. Emphasize consulting a healthcare professional before starting any supplement regimen. 8. Fertility considerations. Touch on the challenges PCOS may pose to fertility. Mention fertility treatments and options for those planning to conceive. 9. Hormonal balance. Explain how hormonal imbalances play a role in PCOS. Discuss hormone therapy options prescribed by healthcare professionals. 10. Regular monitoring. Stress the need for regular checkups and monitoring of PCOS symptoms. Encourage open communication with healthcare providers. 11. Stress management. Discuss the impact of stress on PCOS symptoms. Suggest stress reduction techniques such as meditation and yoga. 12. Sleep hygiene. Highlight the importance of adequate sleep for overall health. Discuss the link between PCOS and sleep disturbances. 13. Skincare. Address skin-related concerns associated with PCOS. Provide skincare tips to manage acne and other skin issues. 14. Customized treatment plans. Acknowledge that PCOS treatment is not one size fits all. Encourage viewers to work with their healthcare providers to develop personalized plans. 15. Educational resources. Recommend reliable sources for further PCOS education. Mention reputable websites and support groups. 16. Community support. Emphasize the value of connecting with others who have PCOS. Mention online forums or local support groups. 17. Ongoing education. Encourage viewers to stay informed about new developments in PCOS research. Highlight the importance of staying proactive in managing one's health. 18. Mind-body connection. Discuss the impact of mental health on PCOS. Encourage practices that promote a healthy mind-body connection. 19. Long-term outlook. Discuss the long-term management of PCOS. Address the potential impact on overall health as women age. 20. Conclusion. Summarize key points. Encourage viewers to take a proactive approach to their PCOS management. Remember to tailor the script to your audience and provide accurate, up-to-date information. Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. 9. Stay hydrated. Emphasize the importance of staying hydrated for overall reproductive health. 10. Reduce stress. Discuss stress management techniques as stress can impact fertility. 11. Supplements. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications. Briefly mention medications that may be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS. Balancing act. A guide for pregnant working women. Managing work while being pregnant can be a challenging but manageable experience. Here are some tips for pregnant women who are also working. 1. Communication with your employer. Inform your employer about your pregnancy in a timely manner. This allows them to make any necessary adjustments and accommodations. Discuss your plans for maternity leave and ensure you understand your company's policies regarding pregnancy and parental leave. 2. Schedule regular prenatal checkups. Attend all necessary prenatal appointments to ensure the health of both you and your baby. Communicate with your employer about these appointments in advance and discuss any necessary time off. 3. Flexible work arrangements. If possible, explore flexible work options such as telecommuting or adjusting your work hours to accommodate your changing needs and energy levels. 4. Take breaks and rest. Listen to your body and take breaks when needed. Short breaks can help alleviate fatigue and stress. Ensure you have a comfortable chair and workspace to support your changing body. 5. Stay organized. Use tools like calendars, planners, or apps to stay organized and manage your workload efficiently. Prioritize tasks and focus on what's most important to reduce stress. 6. Delegate tasks. If you have the opportunity, delegate tasks that can be handled by others. This can help lighten your workload and reduce stress. 7. Stay hydrated and eat well. Proper nutrition is crucial during pregnancy. Stay hydrated and eat balanced, healthy meals to maintain your energy levels. 8. Seek support from colleagues. Let your colleagues know about your pregnancy, especially if it may affect your work in any way. They can provide support and understanding. 9. Create a comfortable workspace. Make your workspace more comfortable by adding cushions or ergonomic accessories as needed. 10. Know your rights. Familiarize yourself with your rights as a pregnant employee. Understanding your legal protections can help ensure fair treatment in the workplace. 11. Plan for maternity leave. Work with your employer to plan for your maternity leave. Make sure you understand how your role will be covered during your absence. Remember, it's essential to prioritize your health and the health of your baby during this time. Don't hesitate to communicate openly with your employer, seek support from your colleagues, and make adjustments as needed to manage the demands of both work and pregnancy. Fast track to fertility, expert tips from a leading doctor. 1. Introduction. Welcome, viewers. Today we're sharing the top 20 tips to boost fertility and increase your chances of getting pregnant fast. 2. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet and regular exercise to support overall well-being. 3. Nutrient-rich foods. Focus on nutrient-rich foods, including fruits, vegetables, whole grains, and lean proteins to enhance fertility. 4. Hydration. Stay well hydrated by drinking plenty of water, promoting optimal reproductive health. 5. Limit caffeine and alcohol. Reduce caffeine and alcohol intake, as excessive consumption can impact fertility. 6. Maintain a healthy weight. Achieve and maintain a healthy weight, as both underweight and overweight conditions can affect fertility. 7. Regular exercise. Engage in regular moderate exercise, which can positively influence reproductive health. 8. Balanced hormones. Ensure hormonal balance through a healthy lifestyle and, if needed, consult with a doctor for guidance. 9. Quit smoking. Quit smoking as it has detrimental effects on fertility and reproductive organs. 10. Stress management. Practice stress management techniques such as meditation, yoga, or deep breathing to reduce stress levels. 11. Regular checkups. Schedule regular checkups with a fertility specialist to monitor reproductive health. 12. Know your cycle. Understand your menstrual cycle to identify your most fertile days and optimize conception timing. 13. Tracking ovulation. Use ovulation prediction kits or apps to track ovulation accurately for better timing. 14. Position matters. Experiment with different sexual positions to increase the chances of sperm reaching the egg. 15. Optimal timing. Be consistent with intercourse during the fertile window to maximize the chance of conception. 16. Sperm health. Encourage sperm health by avoiding hot tubs, tight underwear, and excessive heat exposure. 17. Preconception supplements. Consider taking preconception supplements like folic acid to support a healthy pregnancy. 18. Limit exposure to harmful substances. Minimize exposure to environmental toxins and chemicals that may affect fertility. 19. Fertility-friendly lubricants. Use fertility-friendly lubricants that do not hinder sperm movement. 20. Patience and emotional support. Be patient and seek emotional support during the fertility journey, understanding that it may take time. Conclusion. Thank you for watching. Implementing these tips can significantly boost your chances of getting pregnant fast. Remember, consulting with a fertility specialist is crucial for personalized advice. Top 20 Tips for Natural Conception, your ultimate guide. 1. Understand your menstrual cycle. Track your menstrual cycle to identify your fertile days. 2. Healthy lifestyle. Maintain a balanced diet, exercise regularly, and avoid excessive stress. 3. Maintain a healthy weight. Both underweight and overweight can affect fertility, so strive for a healthy BMI. 4. Regular exercise. Engage in moderate exercise to enhance overall health and reproductive function. 5. Limit caffeine and alcohol. Excessive caffeine and alcohol intake can impact fertility, so consume them in moderation. 6. Quit smoking. Smoking can reduce fertility, so kick the habit for a healthier reproductive system. 7. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 8. Stay hydrated. Drink plenty of water to keep your body well hydrated. 9. Nutrient-rich diet. Include foods rich in vitamins and minerals essential for reproductive health. 10. Folic acid. Intake. Take a prenatal vitamin with folic acid to reduce the risk of neural tube defects. 11. Reduce toxin exposure. Limit exposure to environmental toxins that can impact fertility. 12. Know your ovulation signs. Recognize ovulation signs such as changes in cervical mucus and basal body temperature. 13. Optimal sexual positions. Certain positions may increase the chances of sperm reaching the egg. 14. Regular intimacy. Aim for regular intercourse, especially during your fertile window. 15. Reduce stress. Practice stress-reducing techniques like meditation or yoga to promote fertility. 16. Avoid lubricants with spermicidal agents. Choose fertility-friendly lubricants to enhance sperm motility. 17. Limit hot baths and saunas. Excessive heat can negatively impact sperm production, so avoid prolonged exposure. 18. Partner's health matters. Ensure your partner maintains a healthy lifestyle for optimal sperm quality. 19. Medical checkup. Visit a healthcare professional for a preconception checkup to address any potential issues. 20. Patience and persistence. Understand that conception may take time. Stay positive and persistent. Remember, these tips are general guidance. If you encounter challenges, consult with a healthcare professional for personalized advice. Unlocking the secret to boost female fertility. Top 20 foods for improved egg quality. Introduction. Hello everyone. Welcome back to our channel. Today we have an incredibly important topic to discuss, something that many women may find valuable on their fertility journey. We'll be diving into the top 20 foods that can significantly enhance female egg quality. If you're ready to unlock the secret to boosting your fertility, stay tuned. Segment 1. Importance of female egg quality. Before we get into the list, let's understand why female egg quality is crucial for conception. The quality of your eggs plays a pivotal role in fertility, affecting not just the likelihood of conception, but also the health of the baby. Now, let's jump into the first set of foods that can make a positive impact. Segment 2. Dark leafy greens. Our number 1 on the list is dark leafy greens such as spinach and kale. Packed with essential nutrients like folate and iron, these greens promote optimal egg development and overall reproductive health. Add a generous serving of these greens to your diet for a fertility boost. Segment 3. Berries. Next up, we have berries. Blueberries, strawberries, and raspberries. Loaded with antioxidants, these little powerhouses protect your eggs from oxidative stress, enhancing their quality. Snack on a handful of berries daily to give your fertility a sweet and nutritious kick. Segment 4. Avocado. Moving on to number 3. Avocados. Rich in monounsaturated fats and vitamin E, avocados support hormonal balance and nourish your reproductive system. Incorporating avocados into your diet can positively impact your egg quality over time. Segment 5. Fatty fish. Let's talk about fatty fish like salmon and mackerel, omega-3. Fatty acids found in these fishes are essential for reproductive health. They not only improve egg quality, but also contribute to a healthy pregnancy. Aim for at least 2 servings of fatty fish per week. Segment 6. Nuts and seeds. Nuts and seeds come in at number 5. Almonds, walnuts, and flax seeds are rich in omega-3s and antioxidants, promoting better egg quality. Snacking on a handful of these daily can be a simple yet effective way to boost your fertility. Segment 7. Quinoa. Quinoa takes the 6th spot on our list. This whole grain is a fantastic source of protein and essential amino acids, supporting overall reproductive health. Swap out refined grains for quinoa to give your body the nutrients it needs for optimal eggs quality. Segment 8. Greek yogurt. Number 7 is Greek yogurt. Packed with protein and probiotics, Greek yogurt promotes a healthy gut, positively influencing your reproductive system. Choose the unsweetened variety for maximum benefits. Segment 9. Broccoli. Broccoli, our 8th contender, is rich in folate and other crucial nutrients. It aids in regulating hormones and supporting healthy egg development. Steam or stir-fry broccoli as a tasty and nutritious side dish to boost your fertility. Segment 10. Lean protein. Lean protein sources like chicken and turkey make it to number 9. Protein is essential for overall health, and incorporating lean sources into your diet helps provide the necessary building blocks for optimal egg quality. Segment 11. Eggs. It might sound cliche, but eggs are our number 10. They are a fantastic source of high-quality protein, choline, and antioxidants. Including eggs in your diet can contribute to improved egg quality over time. Segment 12. Citrus fruits. Let's move on to number 11, citrus fruits like oranges and grapefruits. Packed with vitamin C, these fruits support the production of collagen, a crucial component for healthy eggs. Add a citrusy twist to your diet for a fertility boost. Segment 13, pumpkin seeds. Pumpkin seeds claim the 12th spot on our list. These tiny seeds are rich in zinc, a mineral essential for reproductive health. Snacking on pumpkin seeds can contribute to better egg quality and hormonal balance. Segment 14, beans and lentils. Beans and lentils come in at number 13. These plant-based protein sources are high in fiber and essential nutrients, supporting hormonal balance and reproductive health. Incorporate a variety of beans and lentils into your meals. Segment 15, sweet potatoes. Number 14 is sweet potatoes. Packed with beta-carotene and vitamin A, sweet potatoes support healthy egg development. Swap regular potatoes for the sweet variety to enhance your fertility. Segment 16, tomatoes. Tomatoes take the 15th spot. Rich in lycopene, an antioxidant, tomatoes support reproductive health by protecting eggs from damage. Add fresh tomatoes to your salads or enjoy them in cooked dishes. Segment 17, asparagus. Asparagus claims the 16th spot. This green veggie is loaded with folate, promoting optimal egg quality and hormonal balance. Steam or roast asparagus for a delicious and fertility-boosting side dish. Segment 18, beets. Beets at number 17 are rich in nitrates and antioxidants. They support blood flow to the reproductive organs, positively influencing egg quality. Incorporate beets into your diet for a natural fertility boost. Segment 19, lean red meat. Lean red meat makes it to number 18. Rich in iron and zinc, red meat supports overall reproductive health. Choose lean cuts and enjoy them in moderation to enhance your fertility. Segment 20, water. Last but not least, staying hydrated is crucial for optimal fertility. Drinking enough water ensures proper circulation, supporting the delivery of nutrients to the reproductive organs. So, don't forget to keep yourself well hydrated throughout the day. Conclusion, and there you have it, the top 20 foods to improve female egg quality. Remember, making these dietary changes is a journey, and consistency is key. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more valuable content. Wishing you all the best on your fertility journey. Until next time, take care. Outro. Thank you for watching, and we'll see you in the next video. Stay healthy and happy. Understanding common causes of poor egg quality. Intro. Hello everyone. Welcome back to our channel. Today we'll be diving into a crucial topic for those navigating fertility and reproductive health: the common causes of poor egg quality. If you're new here, don't forget to subscribe and hit the notification bell so you never miss out on valuable information. Let's jump right in. 1. Age. As we age, the quality of our eggs naturally declines. Advanced maternal age is a significant factor in poor egg quality. 2. Hormonal imbalances. Imbalances in hormones, such as FSH and LH, can impact egg quality. Maintaining hormonal balance is crucial for optimal fertility. 3. Smoking. Smoking is known to accelerate the decline of ovarian reserve and negatively affect egg quality. Quitting smoking can positively impact fertility. 4. Poor diet. A nutrient-rich diet is essential for reproductive health. Lack of key vitamins and minerals can compromise egg quality. Focus on a well-balanced diet. 5. Obesity. Being overweight can disrupt hormonal balance and affect egg quality. Maintaining a healthy weight is vital for fertility. 6. Underweight. Conversely, being underweight can also impact fertility. Adequate nutrition is essential for optimal egg development. 7. Environmental toxins. Exposure to environmental toxins, such as pollutants and chemicals, can negatively affect egg quality. Minimize exposure whenever possible. 8. Stress. Chronic stress can disrupt hormonal balance and impact reproductive health. Incorporating stress management techniques is crucial for fertility. 9. Alcohol consumption. Excessive alcohol intake can be detrimental to egg quality. Moderation is key when it comes to alcohol consumption during fertility journeys. 10. Lack of exercise. Regular exercise promotes overall health, including reproductive health. Sedentary lifestyles may contribute to poor egg quality. 11. Ovulation disorders. Irregular ovulation patterns or disorders can lead to poor egg quality. Seeking medical advice for irregular cycles is important. 12. Genetic factors. Some individuals may have genetic predispositions that affect egg quality. Genetic counseling can provide valuable insights. 13. Polycystic ovary syndrome, PCOS. PCOS can impact hormonal balance and egg development. Managing PCOS through lifestyle changes and medical interventions is crucial. 14. Endometriosis. Endometriosis can affect egg quality by causing inflammation. Seeking treatment for endometriosis is essential for fertility. Thyroid disorders. Thyroid imbalances can impact reproductive health. Regular thyroid monitoring and management are important for optimal fertility. Diabetes. Uncontrolled diabetes can affect egg quality. Managing blood sugar levels is crucial for individuals with diabetes trying to conceive. Autoimmune disorders. Some autoimmune disorders can affect fertility. Consultation with a specialist is recommended for those with autoimmune conditions. Poor egg reserve. Low ovarian reserve can contribute to poor egg quality. Regular fertility assessments can help understand and address this issue. Infections. Untreated infections can negatively impact reproductive organs and egg quality. Prompt medical attention is important. Medication side effects. Some medications may have side effects that affect fertility. Consult your healthcare provider if you have concerns about medications and fertility. Outro. That wraps up today's video on the common causes of poor egg quality. If you found this information helpful, don't forget to give it a thumbs up and share it with others who might benefit. Remember, every fertility journey is unique, and seeking professional advice is crucial. Until next time, stay informed and take care of your reproductive health. Thanks for watching. Stay healthy. This winter, tips to avoid colds and flu. 1. Introduction. Hey everyone, welcome back to Healthcare Lover. 2. Importance of winter health. As winter approaches, it's crucial to focus on protecting ourselves from coughs and flu. 3. Hand hygiene. Start with the basics. Wash your hands regularly to prevent the spread of germs. 4. Avoid touching face. Resist touching your face, especially your eyes, nose, and mouth, to minimize the risk of infection. 5. Healthy lifestyle. Maintain a healthy lifestyle with a balanced diet, regular exercise, and adequate sleep. 6. Stay hydrated. Keep yourself hydrated. It helps to flush out toxins and supports overall immune function. 7. Warm clothing. Bundle up. Dress warmly to protect yourself from the cold and prevent illnesses. 8. Flu shot. Consider getting a flu shot. It's a proactive measure against seasonal influenza. 9. Stay active. Engage in indoor activities to stay active and boost your immune system. 10. Air quality. Ensure good indoor air quality by ventilating your living spaces regularly. 11. Avoid crowded places. Minimize exposure to crowded places to reduce the risk of coming into contact with viruses. 12. Use tissues. Practice good respiratory hygiene by using tissues when you cough or sneeze. 13. Dispose of tissues properly. Dispose of used tissues immediately to prevent the spread of germs. 14. Hand sanitizer. Carry hand sanitizer for situations where soap and water are not readily available. 15. Boost vitamin intake. Consider supplements, like vitamin C, to give your immune system an extra boost. 16. Warm beverages. Enjoy warm beverages like herbal teas to soothe your throat and stay hydrated. 17. Humidify your home. Use a humidifier to maintain optimal humidity levels in your home, reducing the risk of respiratory issues. 18. Rest when needed. Listen to your body and rest when necessary. Adequate rest is crucial for a strong immune system. 19. Stay informed. Stay informed about flu outbreaks in your area and take extra precautions if needed. 20. Conclusion. Thanks for tuning in. Remember these tips to stay healthy and ward off coughs and flu this winter? Don't forget to like, subscribe, and share for more health tips. The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to proper healthcare may be compromised, affecting both maternal and child health. 14. Generational cycle. Teenage pregnancy can perpetuate a cycle, as children of teen moms may be more likely to become teen parents themselves. 15. Limited career opportunities. Teen moms often face difficulties pursuing and maintaining careers, impacting their financial independence. 16. Child poverty. Children of teenage parents are at a higher risk of living in poverty. 17. Higher rates of preterm births. Teenage pregnancies are associated with higher rates of preterm births, affecting the baby's health. 18. Child abuse. Risk. Teen parents may be at a higher risk of unintentional child abuse due to lack of experience and stress. 19. Impact on educational goals. Teen moms may struggle to achieve their educational goals, limiting their potential in various fields. 20. Prevention and support. It's crucial to focus on prevention and provide support systems to help reduce the impact of teenage pregnancy on individuals and society. Closing. Thanks for joining us today. If you found this video informative, don't forget to like, share, and subscribe. Let's continue the conversation in the comments below. Until next time, stay informed. Welcome back to Healthcare Lover. Today, we're diving into a topic that's close to my heart, eating healthy on a budget. Yep, you heard it right. Eating nutritious meals doesn't have to break the bank. Stick around as we unveil the top 20 points for healthy eating on a budget. Point 1. Plan your meals. Host. First things first, folks. Planning is key. Take a little time each week to plan your meals. It not only helps you stay organized, but also prevents unnecessary trips to the store, and those impulse junk food buys. Point 2. Buy in bulk. Now, let's talk about buying in bulk, purchasing staples like rice, beans, and oats. In bulk not only saves money, but ensures you always have a solid foundation for your meals. Point 3. Seasonal produce. Ah, the beauty of seasonal produce. Opt for fruits and veggies that are in season. They're not only fresher, but also more affordable. Pro tip: farmers markets are fantastic for scoring some great deals. Point 4. Frozen is your friend, don't shy away from the frozen aisle. Frozen fruits and vegetables are often just as nutritious as fresh ones and have a longer shelf life. Plus, they can be more budget-friendly. Point 5. Meal prep magic. Meal prep is a game changer. Spend a few hours each week preparing your meals in advance. Not only does it save you time, but it also keeps you from opting for those less healthy, on-the-go choices. Point 6. DIY snacks. Snacking doesn't have to be a guilty pleasure. Make your own snacks at home, like trail mix or granola bars. It's not only healthier, but also more cost-effective. Point 7. Store brands rock. Let's talk about loyalty. Store loyalty. Don't overlook store brands. They're often just as good as the fancy labels, but come with a friendlier price tag. Point 8. Coupon craze. Coupons, coupons, coupons. Embrace the coupon craze. Keep an eye out for discounts, both online and in-store. They can add up to significant savings over time. Point 9. Buy frozen proteins. Protein can be pricey, but fear not. Frozen proteins like chicken breasts or fish fillets are often more affordable than their fresh counterparts. Stock up when you spot a good deal. Point 10. Nourish on a dime. Nourishing your body doesn't have to cost a fortune. Opt for budget-friendly superfoods like lentils, quinoa, and sweet potatoes. They pack a nutritional punch without emptying your wallet. Outro, and that's a wrap for today's video on healthy eating without breaking the bank. If you found these tips helpful, don't forget to give us a thumbs up, hit that subscribe button, and ring that notification bell so you never miss out on our budget-friendly recipes and wellness tips. Until next time, stay healthy and budget savvy. The benefits of regular exercise intro. Hey folks, welcome back to our channel. Today we've got a game changer for you. Something that can transform your life in more ways than you can imagine. We're talking about the top 20 benefits of regular exercise. Stick around because you won't want to miss out on these incredible advantages. Point 1. First up, let's talk about the boost it gives to your mood. Exercise releases endorphins, the feel-good hormones, leaving you with a natural high. It's like happiness in motion. Point 2. Next on the list is increased energy levels. Contrary to what you might think, exercising regularly can actually amp up your energy, making you more productive throughout the day. Point number 3, better sleep. Regular physical activity promotes a more restful night's sleep, ensuring you wake up refreshed and ready to tackle the day. Point 4. Now, let's talk about the powerhouse, weight management. Exercise helps you burn calories, shed those extra pounds, and maintain a healthy weight. It's your secret weapon in the battle against the bulge. Point 5. Moving on to point 5, improved cardiovascular health. Cardio workouts strengthen your heart, lower blood pressure, and reduce the risk of heart disease. It's like a cardio party for your heart. Point 6.6. Increased muscle strength and tone. Whether you're lifting weights or doing bodyweight exercises, regular workouts sculpt and define your muscles, giving you that strong, toned physique. Point 7. Speaking of strength, exercise boosts bone density, preventing conditions like osteoporosis. It's your ticket to a sturdy and resilient skeletal system. Point 8. Number 8 on our list, enhanced flexibility. Incorporating stretching and flexibility exercises into your routine improves your range of motion, making everyday activities a breeze. Point 9. Let's not forget the immune system. Regular exercise gives your immune system a much-needed boost, helping you fend off illnesses and keeping you in top-notch shape. Point 10, moving swiftly to point 10, stress relief. Exercise acts as a natural stress buster, helping you unwind and cope with the challenges life throws your way. Point 11, and we can't ignore the cognitive benefits. Regular physical activity enhances brain function, sharpens your focus, and improves memory. It's like giving your brain a workout of its own. Point 12. 12 on our list, increased lifespan. Studies show that regular exercise can add years to your life, ensuring you're around for all of life's adventures. Point 13. Point 13. Improved posture. Strengthening your core and back muscles through exercise contributes to better posture, preventing those dreaded slouching habits. Point 14. 14. Social connections. Whether it's joining a fitness class or hitting the gym with friends, exercise provides fantastic opportunities to connect with like-minded individuals. Point 15. Now, let's talk about the glow-up. Regular physical activity promotes healthier skin by increasing blood flow and flushing out toxins. Get ready to shine. Point 16. 16. Better digestion. Exercise aids in digestion, keeping your gut health in check and ensuring everything runs smoothly. Point 17. 17. Increased self-confidence. Achieving fitness goals and seeing positive changes in your body can do wonders for your self-esteem. Point 18. Point 18. Better balance and coordination. Whether you're into yoga or strength training, exercise improves your balance and coordination, reducing the risk of falls. Point 19. 19. Creativity boost. Exercise has been linked to increased creativity, making it the perfect remedy for those creative blocks. Point 20. Last but certainly not least, point 20. Improved quality of life. Regular exercise is the key to living your best life, ensuring you're physically and mentally equipped to tackle whatever comes your way. Outrow. And there you have it, the top 20 benefits of regular exercise. If you haven't already, hit that subscribe button, give this video a thumbs up, and let us know in the comments which benefit surprised you the most. Until next time, stay active, stay healthy, and keep rocking. Menopause and Hormonal Changes Guide Tips Intro. Hey there, wonderful people. Welcome back to Healthcare Lover. Today we're diving deep into a topic that affects so many incredible women out there. Menopause and hormonal changes. Yes, we're unraveling the mysteries behind those 15 crucial points. So, grab a cup of tea, get cozy, and let's get started. Point number one, understanding the basics. Menopause is a natural biological process that every woman goes through, typically in her late 40s or early 50s. It marks the end of the menstrual cycle and fertility. But what exactly happens during this time? Let's find out. Point 2. Hormonal roller coaster. As women approach menopause, there's a significant drop in estrogen and progesterone levels. These hormonal fluctuations can lead to a variety of symptoms, from hot flashes to mood swings. Ladies, you are not alone in this. Point 3. Impact on mood and emotions. Hormones play a crucial role in regulating our emotions. During menopause, the hormone balance can contribute to mood swings, irritability, and even anxiety. It's essential to acknowledge and address these changes. Point 4. The notorious hot flashes. We've all heard about them, but what causes these sudden bursts of heat? Stay tuned as we explore this in point number 4. Point 5. Sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweats, getting a good night's sleep can become quite the struggle. But fear not, we'll discuss strategies to help you catch those ziz. Point 6. Weight gain and metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not, we've got tips to help you maintain a healthy lifestyle during this phase. Point 7. Bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. let's delve into how to support your bones through nutrition and lifestyle choices. Point 8. Memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9. Skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10. Sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11. Managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12. Hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13. Nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14. Exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15. Embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you know. Intro. Hey everyone, welcome back to Healthcare Lover, where we dive deep into topics that matter. Today we're addressing something that affects a huge part of the population, painful periods. Ladies, you're not alone, and today we've got 15 crucial points to help you navigate through this. So grab your favorite cozy blanket and let's get started. Point 1. Acknowledge the pain. First things first, let's acknowledge the pain. Painful periods are real, and it's crucial to recognize and validate what you're going through. Point 2. Understanding the cause. Many factors can contribute to painful periods: hormones, lifestyle, and even underlying medical conditions. It's essential to understand the root cause for effective management. Point 3. Diet matters. Your diet plays a significant role. Foods rich in omega-3 fatty acids, like fish, flax seeds, and walnuts, can help reduce inflammation and ease period pain. Point 4. Hydration. Stay hydrated. Water is your best friend during your period. It helps with bloating and can alleviate some of the discomfort. Point 5. Exercise. I know the last thing you want to do is hit the gym, but trust me, light exercises like yoga or a gentle walk can work wonders in easing those cramps. Point 6. Warm compress. Don't underestimate the power of a warm compress. Applying heat to your lower abdomen can help relax the muscles and provide relief. Point 7. Over-the-counter. Relief. Sometimes over-the-counter pain relievers are necessary. Consult with your healthcare provider to find the right one for you. Point 8. Herbal remedies. Consider herbal remedies like chamomile tea or ginger. These natural options can have soothing effects on your body. Point 9. Stress management. Stress can amplify period pain. Incorporate stress management techniques like meditation or deep breathing into your routine. Point 10. Birth control options. Birth control methods can regulate your menstrual cycle and reduce pain. Discuss the options with your healthcare professional. Point 11. Adequate rest. Your body needs extra TLC during your period. Ensure you get enough rest to allow your body to recover. Point 12. Track your cycle. Understanding. Your menstrual cycle can empower you. Use apps to track your periods and anticipate when pain might strike. Point 13. Seek professional help. If the pain is unbearable or disrupts your daily life, don't hesitate to seek professional help. Your health matters. Point 14. Support systems. Surround yourself with a supportive network. Share your experiences with friends or family who can offer understanding and empathy. Point 15. Self-care rituals. Lastly, indulge in self-care rituals. Whether it's a warm bath, your favorite book, or a guilty pleasure movie, take time for yourself. Conclusion. And there you have it, 15 points to help you navigate through painful periods. Remember, you're not alone, and there are ways to manage and alleviate the discomfort. If you found this video helpful, don't forget to hit that like button, subscribe for more content, and share it with anyone who might benefit. Until next time, take care.
Intro. Hey beauties! Welcome back to our channel. Today, we've got something special for you. 2 amazing skincare routines. We'll be diving into your everyday skincare routine, and of course, the one tailored just for all you expecting moms out there. So buckle up and let's get started. Normal skincare routine. First up, let's talk about your regular skincare routine. It's the foundation for healthy and radiant skin, no matter what stage of life you're in. Point 1. Cleansing. Start your day by cleansing your face with a gentle cleanser. This removes any impurities and sets the stage for the products to come. Point 2. Exfoliation twice a week. Indulge in some exfoliation. This helps to slough off dead skin cells, giving your complexion that lit from within glow. Point 3. Moisturizing hydration is key. Find a moisturizer that suits your skin type to keep it soft and supple. Point 4. Sunscreen. Never skip sunscreen, even on cloudy days. It's your shield against those harmful UV rays. Point 5. Night routine. Before hitting the hay, repeat the cleansing and moisturizing steps. Maybe add a targeted treatment like a serum to address specific skin concerns. Pregnancy skincare routine. Now, for all you fabulous moms-to-be, let's talk about a skincare routine tailored just for you during this special time. Point 1. Gentle cleansing stick to a mild, fragrance-free cleanser to avoid any potential irritations. Point 2. Hydration. Your skin might be in need of some extra hydration now. Consider a rich, nourishing moisturizer to keep that pregnancy glow on point. Point 3. Stretch mark prevention. Don't forget those areas prone to stretch marks. A good stretch mark cream or oil can be a lifesaver. Point 4. Safe ingredients. Opt for skincare products with pregnancy-safe ingredients. Avoid retinoids and other potentially harmful substances. Point 5. Self-care. Lastly, self-care is crucial. Take a moment to pamper yourself with a relaxing face mask or a soothing skincare ritual. You deserve it. Outro. And there you have it. 2 fantastic skincare routines to keep you glowing inside and out. Whether you're sticking to your everyday routine or embracing the beauty of pregnancy, taking care of your skin is always a good idea. If you enjoyed today's video, don't forget to give it a thumbs up, subscribe, and hit that notification bell so you never miss a beauty tip from us. Until next time, stay beautiful. Intro. Hey there, amazing viewers. Welcome back to our channel. Today, we have a topic that's close to the heart, pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like the queen you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity, wear that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your baby's. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful uncertainties of this journey. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all part of your incredible story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love. Journey through the stages of pregnancy. Objectives. Define the 3 main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify and describe the approximate duration of each pregnancy stage, including the weeks and months. Explain the physical and hormonal changes that occur during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy, weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester, pregnancy, weeks 14-17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18-22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23-27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester, pregnancy, weeks 28-31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32-35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36-40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process. Hey there, everyone! Welcome back to Healthcare Lover, where we dive deep into topics that matter to you. Today, we're going to explore something that many women can relate to: lower abdominal pain. Whether you're married or unmarried, this is a common concern, and we've got the top 15 points to shed some light on it. But before we jump in, don't forget to hit that subscribe button and ring the notification bell so you never miss out on our valuable content. Point 1. Menstrual cramps. Number 1 on our list, and probably no stranger to most women, are menstrual cramps. These can range from mild discomfort to debilitating pain, affecting women of all ages. Point 2. Ovulation pain. Next up, we have ovulation pain. It's a common experience for many women and can be felt as a sharp twinge on one side of the lower abdomen. Point 3. Endometriosis. Now, let's talk about endometriosis. This condition occurs when the tissue lining the uterus grows outside of it, leading to pain and inflammation. Point 4. urinary tract infections, UTIs. Moving on to point 4, UTIs. Both married and unmarried women can suffer from these infections, causing pain in the lower abdomen and the urge to frequently pee. Point 5, pelvic inflammatory disease, PID. Number 5 is PID. This infection affects the reproductive organs and can cause chronic lower abdominal pain. It's crucial to seek medical attention if you suspect PID. Point 6, ectopic pregnancy. Ectopic pregnancies can be a serious concern, causing pain in the lower abdomen. If you experience severe pain and suspect an ectopic pregnancy, seek emergency medical help. Point 7, cystitis. Point 7 is cystitis, a condition where the bladder becomes inflamed. This can lead to discomfort and pain in the lower abdomen. Point 8, gastrointestinal issues. Let's not forget about gastrointestinal issues. Conditions like irritable bowel syndrome, IBS, can cause abdominal pain, affecting both married and unmarried women. Point 9, stress and anxiety. Stress and anxiety take the 9th spot on our list. Believe it or not, emotional well-being can manifest physically, leading to pain in the lower abdomen. Point 10, fibroids. Fibroids, non-cancerous growths in the uterus, can also contribute to lower abdominal pain. It's essential to monitor their growth and consult with a healthcare professional. Point 11, ovarian cysts. Ovarian cysts are another common cause of lower abdominal pain. These fluid-filled sacs on the ovaries can be painful, especially if they rupture. Point 12, adhesions. Adhesions, bands of scar tissue that form between abdominal tissues and organs, can cause pain and discomfort. They may develop after surgery or due to inflammation. Point 13, pregnancy. Of course, we can't overlook pregnancy. The stretching of the uterus and hormonal changes can lead to lower abdominal pain for expectant mothers. Point 14, musculoskeletal pain. Musculoskeletal pain, such as muscle strain or ligament sprains, can also manifest in the lower abdomen. This is often overlooked, but can be a significant source of discomfort. Point 15, reproductive system infections. Last but not least, reproductive system infections, such as sexually transmitted infections, STIs, can cause pain in the lower abdomen. Regular checkups and safe practices are essential. Conclusion. And there you have it, folks. The top 15 reasons why both married and unmarried women may experience pain in the lower abdomen. If you found this video helpful, don't forget to give it a thumbs up and share it with others who might benefit. As always, if you're experiencing persistent or severe pain, consult with a healthcare professional. Thanks for tuning in, and we'll see you in the next video. Introduction. Hey there, health enthusiasts! Welcome back to our channel. Today, we're diving into a topic that's often overlooked, but absolutely crucial for a healthy life: regular checkups. I know, it sounds a bit mundane, but stick around because we're about to unravel the importance of these routine health visits in a way that will make you want to book an appointment ASAP. Establishing Connection, Segment 1. Relatable Scenario. Let's start with a scenario we've all been through. You feel perfectly fine, life's going smoothly, and you think, why bother with a checkup? Well, here's the thing. Many health issues show no symptoms in their early stages. Regular checkups act as your health's early warning system, helping you catch problems before they become serious. Preventive Measures, Segment 2. Preventive Measures. Prevention is always better than cure, right? Regular checkups empower you to take control of your health. From cholesterol levels to blood pressure, these screenings detect potential issues before they escalate. It's like having a superhero doctor safeguarding your well-being. Segment 3. Time and Money Saver. Now, I get it. Life is busy, and who has time for doctor visits? But think of it this way. Those regular checkups are a smart investment. They save you both time and money in the long run. Identifying and addressing health concerns early means fewer medical bills and less time spent in waiting rooms. Segment 4. Personalized Health Plan. One size fits all? Not when it comes to health. Regular checkups allow your doctor to create a personalized health plan tailored to your specific needs. It's like having a roadmap for a healthy and happy life, crafted just for you. Segment 5. Mental Health Check. Health isn't just about the physical aspects. Mental well-being matters too. Regular checkups provide an opportunity to discuss your mental health with a professional. It's a safe space to address stress, anxiety, or any concerns you might have. Building a relationship with your doctor. Segment 6. Building a relationship. It's not just about the checkup. It's about building a relationship with your healthcare provider. Trust me, having a familiar face who knows your medical history makes a world of difference when facing health challenges. Segment 7. Encouraging accountability. Consider your regular checkup a health accountability partner. Knowing that you have an upcoming visit encourages you to make positive lifestyle choices. It's that extra push we all need to stay committed to our well-being. Conclusion. So, there you have it. The importance of regular checkup. In a nutshell, it's not just a visit to the doctor, it's an investment in your health and happiness. Remember, your body is your most valuable asset, so treat it with the care it deserves. Don't forget to hit that like button if you found this video helpful and subscribe for more health tips. Until next time, stay healthy.
Oh hey everyone. Welcome back to. Today we have a topic that's close to the hearts of many expecting mothers out there. Maintaining fitness while pregnant. Whether you're a mom-to-be or just curious, this video is packed with tips to keep you active and healthy throughout your pregnancy journey, so let's dive in. Segment 1. The importance of staying active. Pregnancy is not a reason to hit pause on your fitness journey. In fact, staying active during this special time can bring a world of benefits, from boosting your mood to improving your posture and sleep. The advantages are endless, but of course safety is key, so let's talk about the types of exercises that are perfect for moms-to-be. Segment 2. Safe and effective exercises. Now, when it comes to exercising during pregnancy, it's crucial to choose activities that are gentle on your changing body. Opt for low-impact exercises like walking, swimming, and prenatal yoga. These not only keep your heart pumping but also help in maintaining muscle tone and flexibility. Remember, always consult with your healthcare provider before starting any new workout routine. Segment 3. Tailoring your workouts. One size doesn't fit all, especially when it comes to pregnancy workouts. Tailoring your exercises to your individual needs is key. If you were active before pregnancy, you might be able to continue with modifications, but if you're new to exercise, start slow and gradually increase intensity. Our bodies are incredible, and adapting our workouts ensures a healthy journey for both mom and baby. Segment 4. Listen to your body. Pregnancy comes with its own set of physical changes, and it's essential to listen to your body. If something doesn't feel right, modify or skip it. This isn't the time to push your limits. Pay attention to your energy levels and give yourself the rest you need. Remember, a happy and healthy mom means a happy and healthy baby. Segment 5. Building a support system. Host. Staying fit during pregnancy is not just about the physical aspect. Point 4s. Greater than. It's also about having a strong support system. Connect with other expecting moms, join prenatal fitness classes, or even involve your partner in your workouts. Having a community around you can make this journey even more enjoyable. Conclusion. And there you have it. Tips and tricks to stay fit and active during pregnancy. Remember, every pregnancy is unique, so consult with your healthcare provider to create a personalized fitness plan. If you enjoyed this video, give it a thumbs up, and don't forget to subscribe for more content. Take care.
Sure, let us break down the key points for each trimester. First trimester, weeks 1-12, early signs and development overview of conception and early fetal development. Common symptoms like morning sickness, fatigue, and hormonal changes. Importance of prenatal vitamins and a healthy diet. Weeks 5-8, organ formation of vital organs and major body systems. Discuss potential early ultrasound and first heartbeat. Weeks 9-12, transition to second trimester, gradual reduction of some early symptoms. Introduction of prenatal screenings and tests. Second trimester, weeks 13-16, visible changes, baby's growth spurt and noticeable changes in the mother's body. Announcement of pregnancy to friends and family, weeks 17-20, gender reveal, discussion on when and how gender can be determined. Introduction of anatomy scan and potential genetic testing. Weeks 21-24, viability and quickening, fetal viability milestone. First experiences of fetal movements quickening. Third trimester, weeks 25-28, final trimester begins, overview of the home stretch. Importance of monitoring baby's movements. Weeks 29-32, preparing for labor, discussion on birthing classes and birth plans. Baby shower preparations and nesting instincts. Weeks 33-40, final preparations, physical and emotional changes in the mother. Signs of labor and when to contact healthcare provider. Packing hospital bag and finalizing birth plan. Postpartum, labor and delivery overview of labor stages and delivery options. Postpartum recovery and care for both mom and baby. Newborn care, basics of newborn care, feeding, and sleep. Emotional adjustments and potential postpartum support. Remember, this is just an outline. Feel free to expand on each point based on your audience and the depth you want to cover.
Lovely viewers. Welcome back to Healthcare Lover, where we explore the secrets to a healthier and happier life. Today, we're diving into the fascinating world of sleep and its incredible impact on our overall health. Buckle up, hit that like button, and let's get started. Point 1. The restorative power. First on our list is the restorative power of sleep. When we hit the hay, our bodies kick into high gear, repairing tissues and boosting muscle growth. It's like hitting the reset button for our physical well-being. Point 2. Cognitive function. Now, let's talk brains. Quality sleep is like a brain spa. It enhances cognitive function, improves concentration, and boosts memory. So, if you want to be on top of your game mentally, prioritizing your ZZZs is a must. Point 3. Mood management. Ever notice how everything seems better after a good night's sleep? That's not a coincidence. Sleep plays a vital role in regulating mood and emotional well-being. It's your secret weapon against grumpiness. Point 4. Hormonal balance. Hormones, those little messengers in our bodies, are heavily influenced by sleep. A lack of sleep can mess with hormone production, leading to weight gain, stress, and even an increased risk of chronic diseases. Let's keep those hormones happy. Point 5. Metabolic boost. If you're looking to shed some pounds, don't underestimate the power of a solid sleep routine. Quality sleep supports a healthy metabolism, making it easier for you to reach and maintain a healthy weight. Point 6. Immune system fortification. Ready to fend off those pesky germs? Adequate sleep is your body's best defense. It boosts the immune system, helping you stay in the ring and fight off illnesses like a champ. Point 7. Inflammation reduction. Inflammation. Nobody wants it. Luckily, sleep is a natural anti-inflammatory. It helps reduce inflammation, lowering the risk of chronic diseases and keeping your body in a state of blissful balance. Point 8. Heart health. Our hearts work hard for us, so let's show them some love. Quality sleep is linked to a healthier heart. It helps regulate blood pressure and reduces the risk of cardiovascular issues. Sweet dreams for a strong heart. Point 9. Recovery for athletes. Calling all athletes. If you're hitting the gym or the field regularly, sleep is your best workout buddy. It aids in muscle recovery, improves performance, and ensures you're ready to tackle your next fitness challenge. Point 10. Longevity boost. Last but certainly not least, let's talk longevity. The secret to a longer, healthier life might just be under your pillow. Studies suggest that consistent, quality sleep is associated with increased life expectancy. So, here's to more nights of restful slumber and a longer, brighter future. Conclusion. And there you have it. 10 incredible ways sleep impacts our health. From physical restoration to mental sharpness and even the potential for a longer life, the benefits are undeniable. If you found this video eye-opening, don't forget to hit that subscribe button, ring the notification bell, and share your thoughts in the comments below. Until next time, sleep tight and stay healthy.
Comfort is key. Invest in cozy maternity clothes and a supportive pillow for better sleep. Hydration heroes, keep yourself hydrated with water and soothing herbal teas to ease any nausea. Snack attack, stock up on healthy snacks to curb hunger and provide essential nutrients. Prenatal power, don't forget your prenatal vitamins for the extra boost of nutrients. Ginger goodness, ginger candies or teas can help alleviate nausea. Knowledge is power, read up on pregnancy books to understand the changes happening in your body. Self-care essentials, pamper yourself with skincare products safe for pregnancy. Baby brain organizer, stay organized with a pregnancy journal or app to track appointments and milestones. Support system, surround yourself with a supportive network of friends and family. Relaxation ritual. Introduction, greet your audience and share your excitement about discussing pregnancy must-haves. Mention that these are items you found essential during your own pregnancy. Comfort is key, maternity pillow, discuss the importance of a good maternity pillow for comfortable sleep. Mention different types available and why you recommend a specific one. Stretch mark cream, talk about the changes in skin during pregnancy. Recommend a stretch mark cream or oil that worked well for you. Maternity wardrobe, maternity clothes, emphasize the need for comfortable and stylish maternity clothes. Highlight key pieces like maternity leggings, nursing bras, and loose-fitting tops. Belly band, explain how a belly band provides support for the growing belly. Share your experience with using one and recommend brands. Health and wellness, prenatal vitamins, stress the importance of prenatal vitamins for both mom and baby. Mention any specific brands or types that your healthcare provider recommended. Hydration, remind viewers to stay hydrated during pregnancy. Suggest a favorite water bottle or hydration method. Preparing for baby, hospital bag essentials, discuss what to pack in your hospital bag. Include items like comfortable clothing, toiletries, and essential documents. Baby registry must-haves, touch on key items to include in your baby registry. Mention practical items like a crib, stroller, and car seat. Self-care, pampering products, recommend self-care items for relaxation. Recommend self-care items for relaxation. This could include a favorite scented candle, bath salts, or a good book. Prenatal yoga or exercise, share the benefits of staying active during pregnancy. Recommend prenatal yoga or exercises that worked for you. Support system, joining a mom group, discuss the importance of a support system. Suggest joining a local or online mom group for advice and camaraderie. Partner involvement, highlight ways partners can be involved and supportive during pregnancy. This could include attending prenatal classes together or helping with household chores. Closing, summarize the key pregnancy must-haves discussed. Encourage viewers to share their own must-haves in the comments. Remember to speak from your own experiences, and make it personal to connect with your audience. Good luck with your YouTube video. Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1, balanced diet, emphasize the need for a well-balanced diet. Include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2, folic acid and iron. Discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals. Highlight the importance of iron for preventing anemia during pregnancy. Include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3, omega-3 fatty acids. Explain the benefits of omega-3 fatty acids for the baby's brain development. Include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4, adequate hydration. Stress the importance of staying hydrated during pregnancy. Recommend water as the primary beverage. Limit caffeine intake and avoid sugary drinks. Point 5, calcium for bone health. Discuss the need for calcium in supporting the baby's bone development. Include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6, small, frequent meals. Suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7, foods to avoid. List foods that should be avoided during pregnancy: raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion, recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers to
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Unveiling the power of sweet potatoes, health benefits, and side effects. In the realm of nutrition, few foods are as versatile and nutrient-packed as sweet potatoes. Packed with flavor and boasting a vibrant orange hue, these tuberous delights offer a plethora of health benefits. Let's dive into the sweet world and explore its advantages and potential side effects. Nutrient-rich goodness. At the core of the sweet potato's allure lies its impressive nutritional profile, bursting with essential vitamins, notably vitamin A, C, and B6, along with a healthy dose of fiber and potassium, provides a wholesome package for overall well-being. A boost for vision. One standout feature of sweet potatoes is their contribution to eye health. The high beta-carotene content, a precursor to vitamin A, promotes good vision and may help prevent age-related macular degeneration, keeping your eyesight sharp and clear. Immunity armor. Acts as a potent supporter of the immune system. Vitamin C, abundant in sweet potatoes, is renowned for its role in strengthening the body's defense mechanisms. Regular consumption can help ward off infections and keep you feeling your best. Blood sugar balancer. Contrary to common misconceptions, sweet potatoes can be a friend to those watching their blood sugar levels. The fiber content aids in stabilizing blood glucose levels, offering a steady release of energy and reducing the risk of sudden spikes. Heart-healthy elixir. Your heart will thank you for incorporating it into your diet. The potassium content helps regulate blood pressure, reducing strain on the cardiovascular system. This, coupled with the fiber's cholesterol-lowering effects, makes sweet potatoes a heart-healthy choice. Gut-friendly vibes. Digestive health is another area where sweet potatoes shine. The fiber content promotes a healthy gut by supporting regular bowel movements and nourishing the beneficial gut bacteria, ensuring your digestive system operates smoothly. Workout fuel and muscle support. For fitness enthusiasts, sweet potatoes offer a natural source of energy. The complex carbohydrates provide sustained fuel for workouts, while the potassium aids in preventing muscle cramps and promoting efficient muscle function. Skin glow galore. Beautiful skin starts from within, and sweet potatoes can be your secret weapon. The combination of vitamins A and C promotes collagen production, contributing to a radiant complexion and helping combat signs of aging. Navigating potential side effects. While the benefits of sweet potatoes are numerous, it's essential to be aware of potential side effects. Consuming excessive amounts may lead to a surplus of certain nutrients, potentially causing digestive discomfort. Moderation is key to harness the benefits without going overboard. Allergic reactions. In rare cases, individuals may experience allergic reactions to sweet potatoes. If you notice itching, swelling, or difficulty breathing after consumption, it's crucial to seek medical attention promptly. Conclusion: embrace the sweet symphony of health. In conclusion, sweet potatoes are a nutritional powerhouse that deserves a prime spot on your plate. From supporting your immune system to enhancing skin health and providing sustained energy, these tubers offer a multitude of benefits. However, like any good thing, moderation is key to avoid potential side effects. So embrace the sweet symphony of health by incorporating it into your diet and savor the myriad benefits it brings to the table. Your taste buds and your body will thank you for it. Thank you for watching this video and considering subscribe.
Introduction: greet viewers and acknowledge the challenges of the third trimester. Establish the purpose of the video, providing tips to make the third trimester more manageable. Physical comfort: discuss comfortable clothing choices for the growing belly. Highlight the importance of proper sleep and suggest maternity pillows. Mention gentle exercises suitable for the third trimester. Nutrition and hydration: emphasize the need for a well-balanced diet and increased water intake. Recommend nutritious snacks that provide sustained energy. Discuss foods rich in essential nutrients for both mom and baby. Emotional well-being: address common emotional challenges and offer coping strategies. Suggest relaxation techniques such as prenatal yoga or meditation. Encourage open communication with a partner or support network. Preparing for labor and delivery: briefly discuss birth plans and preferences. Highlight the importance of prenatal classes and staying informed. Provide tips for packing a hospital bag and knowing when to go to the hospital. Nesting and baby prep: offer practical advice for setting up the nursery. Discuss baby essentials and help prioritize purchases. Mention the importance of self-care and taking breaks. Medical checkups and monitoring: stress the significance of regular checkups and following medical advice. Discuss common symptoms and when to contact a healthcare professional. Provide information on fetal movement monitoring. Community and support: encourage joining prenatal classes or online communities. Discuss the value of connecting with other expectant mothers. Emphasize the importance of a supportive network during this time. Final preparations: talk about completing any outstanding tasks or projects. Offer tips for creating a calm and positive environment at home. Discuss the excitement of nearing the due date. Conclusion: summarize key points. Encourage viewers to share their own tips and experiences in the comments. Express best wishes for a smooth and positive third trimester. Remember to add your own personal touch and experiences to make it more engaging. Host: warm smile. Hey there, beautiful souls. Welcome back to our channel. Today's video is incredibly important as we're delving into a topic that touches the lives of so many: breast cancer. Host: empathetic tone. Before we dive in, remember, you are not alone. Whether you're on a personal journey or supporting a loved one, this video is for you. Segment 1: Understanding breast cancer. Host: serious tone. First things first, understanding breast cancer is crucial. It's not just a disease, it's a journey that many brave individuals face every day. Host: compassionate voice. Breast cancer comes in different stages, and early detection plays a pivotal role. Know your body, perform regular self-exams, and schedule those screenings. Host: genuine smile. Now, let us hear some powerful stories of resilience. We've gathered a few incredible individuals who are sharing their journeys with breast cancer. Guest 1 smiling. It's not just a battle with cancer, it's a journey of self-discovery. I found strength I never knew I had. Guest 2 holding back tears. Support is everything. Having a strong support system makes the toughest days a little brighter. Host: passionate tone. Awareness is a game changer. Let us break the stigma and encourage open conversations about breast health. Share this video with your friends and family to spread the word. Host: encouraging smile. Together, we can make a difference. Knowledge is power, and by sharing information, we can save lives. Host: reflective tone. Thank you for joining us on this journey today. Remember, you are strong, you are resilient, and you are not alone. If you found this video helpful, give it a thumbs up, subscribe, and hit that notification bell. Host: final words. Stay beautiful, stay strong, and until next time, take care of yourselves and each other. Bye for now. Introduction: greet your audience and share the purpose of the video. Briefly mention the joy and challenges of the pregnancy journey. First trimester: discuss the early signs of pregnancy. Emphasize the importance of prenatal care and doctor visits. Address common symptoms like morning sickness and fatigue. Second trimester, highlight the development of the baby during this period. Talk about the mother's changing body and emotions. Mention the anatomy scan and its significance. Third trimester, discuss the baby's final stages of development. Address common discomforts and preparations for labor. Talk about birth plans and hospital bag essentials. Critical issues, outline potential complications during pregnancy. Discuss warning signs and when to seek medical help. Cover topics such as gestational diabetes, preeclampsia, and others. Labor and delivery, explain the stages of labor. Discuss pain management options and birthing plans. Emphasize the support system and the role of a birthing partner. Postpartum period, highlight the emotional and physical challenges after birth. Discuss postpartum care, including self-care and seeking support. Address the importance of the postpartum checkup. Closing, summarize key points from the pregnancy journey. Encourage viewers to share their experiences and seek professional advice. Remember to keep the tone positive, informative, and supportive throughout the video. Introduction. Welcome, everyone. Today, we're diving into the fascinating world of immune health. Hydration habits. Tip 1. Stay hydrated. Water is the essence of life and a key player in maintaining a robust immune system. Balanced diet essentials. Tip 2. Load up on fruits, veggies, and whole grains for a diverse range of nutrients that support immune function. The power of antioxidants. Tip 3. Antioxidants, found in foods like berries and nuts, help protect your cells from damage and give your immune system a boost. Vitamin C superhero. Tip 4. Don't forget your vitamin C. Citrus fruits and leafy greens can help enhance the production of white blood cells. Sunshine vitamin D. Tip 5. Soak in some sun. Vitamin D, obtained through sunlight, is crucial for a well-functioning immune system. Regular exercise routine. Tip 6. Break a sweat regularly. Exercise promotes good circulation, allowing immune cells to move freely throughout the body. Adequate sleep importance. Tip 7. Get your beauty sleep. Quality rest is when your body does significant repair work, strengthening your immune defenses. Stress management techniques. Tip 8. Keep stress at bay. Chronic stress weakens the immune system, so practice relaxation techniques like meditation or yoga. Good hygiene practices. Tip 9. Wash your hands regularly. Simple hygiene habits are your first line of defense against harmful pathogens. Moderation in everything. Tip 10. Balance is key. Avoid excessive alcohol and maintain a healthy body weight for overall immune resilience. Conclusion. Thanks for tuning in. Remember, a strong immune system is your best ally in the journey to a healthier, happier you. Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6, Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10, First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13, First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16, Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20, Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24, Maternity fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28, Baby shower preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32, Third trimester challenges. Address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36, Nesting and preparing. Show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40, Final countdown. Share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery. Document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby. Postpartum. Introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion. Express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family. Introduction. Welcome viewers and thank them for tuning in. Highlight the importance of recognizing heart attack symptoms and taking preventive measures. Section 1. Knowing the symptoms. 3. Chest pain. explain that persistent chest discomfort is a common symptom. Mention the sensation of pressure, squeezing, or fullness in the chest. Shortness of breath, discuss how difficulty breathing or sudden shortness of breath can be a warning sign. Emphasize the importance of not ignoring persistent breathlessness. Pain in other areas, point out that discomfort may extend to the arms, neck, jaw, back, or stomach. Encourage viewers to be aware of any unusual pain in these regions. Section 2, Risk Factors 6. Age and gender, explain that older age and being male generally increase the risk. Acknowledge that women may experience different symptoms and should be vigilant. Lifestyle factors, discuss the impact of unhealthy diet, lack of exercise, and smoking. Stress the importance of adopting a heart-healthy lifestyle. Medical conditions, highlight conditions like diabetes, hypertension, and high cholesterol. Urge viewers with these conditions to manage them effectively. Section 3, Precautions and Prevention 9. Healthy diet, recommend a balanced diet rich in fruits, vegetables, and whole grains. Emphasize the benefits of reducing salt, sugar, and saturated fats. Regular exercise, stress the role of physical activity in maintaining heart health. Suggest achievable exercise routines and activities. Regular health checkups, encourage regular checkups to monitor blood pressure, cholesterol, and overall heart health. Remind viewers to follow medical advice for managing existing conditions. Conclusion. 12. Summarize key points about heart attack symptoms and precautions. Encourage viewers to share the video to spread awareness. Remind everyone that early recognition and preventive measures can save lives. Outro. 15. Thank viewers for watching and encourage them to subscribe for more informative content. Provide links to related videos or resources for further information. Hello everyone, and welcome back to our channel. Today, we're diving into the wonderful world of vitamin B12, a vital nutrient that plays a crucial role in our health. In this video, we'll explore the top benefits of vitamin B12 and highlight some foods that are rich in this essential nutrient. So, let us get started. Point 1. Boosts energy and reduces fatigue. Vitamin B12 helps convert food into energy, aiding in the production of red blood cells. Adequate B12 levels can help fight fatigue and boost your overall energy levels. Point 2. Supports brain function. Vitamin B12 is essential for proper neurological function and brain health. It helps in the production of neurotransmitters, which are vital for mood regulation and cognitive function. Point 3. Rich in animal products. Many animal-based excellent sources of vitamin B12. Fish, such as salmon and trout, along with lean meats and dairy products, are great options to include in your diet. Point 4. Plant-based sources. While B12 is predominantly found in animal products, there are some plant-based sources like fortified cereals, plant-based milk, and nutritional yeast. Point 5. Supports nervous system health. Vitamin B12 plays a vital role in maintaining a healthy nervous system. It contributes to the protection of nerve cells' outer layer, promoting overall nerve health. Point 6. Incorporate leafy greens. Some plant foods, like spinach and other leafy greens, contain small amounts of B12. While not as potent as animal sources, they can still contribute to your intake. Point 7. Importance for vegans and vegetarians. For those following a vegan or vegetarian diet, it's crucial to consider B12 supplements or fortified foods to ensure adequate intake. Point 8. Recommended daily intake. The recommended daily intake of vitamin B12 varies by age and gender. It's generally around 2.4 micrograms for adults. Point 9. Cooking tips to preserve vitamin B12 content. Avoid overcooking foods, as it is sensitive to high temperatures. Steaming or microwaving is better than boiling. Point 10. Eggs and dairy products like milk and cheese are excellent sources of vitamin B12. They can be a convenient and tasty way to meet your B12 needs. There you have it, folks. The amazing benefits of vitamin B12 and some fantastic food sources to keep your levels in check. Remember, maintaining proper vitamin B12 intake is essential for your overall well-being. If you found this video helpful, don't forget to hit that like button, subscribe, and share it with your friends. Thanks for tuning in, and we'll see you in the next video. Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. That ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is around 28 days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package instructions. Point 6. Monitor basal body temperature. BBT. Discuss how a woman's basal body temperature rises slightly after ovulation. Instruct viewers to use a basal thermometer and take their temperature every morning before getting out of bed. Point 7. Track cervical mucus changes. Explain that cervical mucus changes in consistency throughout the menstrual cycle. Describe how to observe and record these changes. Point 8. Pay attention to ovulation symptoms. Mention common symptoms like mild pelvic pain, breast tenderness, or heightened senses. Stress that these symptoms are not definitive but can be additional indicators. Point 9. Keep an ovulation calendar. Encourage viewers to create an ovulation calendar. Use a calendar or a smartphone app to track cycle length, OPK results, BBT, and other relevant data. Point 10. Be patient. Remind viewers that it may take a few months of tracking to accurately predict ovulation. Highlight the importance of patience and persistence. Conclusion. Summarize the key points discussed in the video. Remind viewers that understanding their ovulation cycle can be helpful whether they are trying to conceive or manage contraception. End with a call to action. Encourage viewers to subscribe, like, and share the video. Invite them to ask questions or share their experiences in the comments section. Welcome to Health. We're going to discuss the top 10 foods to eat and avoid during pregnancy to ensure a healthy journey for both you and your baby. Point 1. Folate-rich foods. First on our list is folate-rich foods. These include leafy greens, lentils, and citrus fruits. Folate is essential for neural tube development in the baby. Point 2. Lean protein. Lean protein sources like chicken, fish, and tofu are crucial for baby's growth and maternal health. Avoid undercooked or raw seafood. Point 3. Calcium-rich dairy. Next up, calcium-rich dairy products such as milk, yogurt, and cheese support the baby's bone development. Opt for pasteurized options. Point 4. Iron-packed foods. Iron is vital during pregnancy. Include foods like lean red meat, beans, and fortified cereals to prevent anemia. Point 5. Fiber-packed fruits and vegetables. Fiber is your friend during pregnancy. Fruits, veggies, and whole grains help with digestion and reduce constipation. Point 6. Healthy fats. Healthy fats from avocados, nuts, and olive oil are essential for baby's brain development. They also help with your skin and hair. Point 7. Hydration. Staying hydrated is crucial. Drink plenty of water and consider herbal teas, but limit caffeine intake. Point 8. Foods to avoid. Raw seafood and unpasteurized products. Now, let us discuss foods to avoid. First, steer clear of raw seafood and unpasteurized dairy products to prevent foodborne illnesses. Point 9. High mercury fish. High mercury fish like shark and swordfish should be avoided as they can harm the baby's nervous system. Point 10. Processed and high sugar foods. Lastly, minimize processed and high sugar foods. They can lead to excessive weight gain and gestational diabetes. Conclusion. To sum it up, a balanced diet during pregnancy is crucial for a healthy mom and baby. Remember to consult your healthcare provider for personalized advice. Call TO Action. If you found this information helpful, don't forget to like, share, and subscribe to our channel for more pregnancy tips and advice. OUTRO, thanks for watching, and we wish you a safe and healthy pregnancy journey. Hey everyone! Welcome back to our channel. Today, we'll be discussing some helpful tips on how to reduce the risk of miscarriage during the first trimester of pregnancy. Remember, it's essential to consult your healthcare provider for personalized advice. So, let us dive right in. Point 1. Early prenatal care. Seek early prenatal care as soon as you find out you're pregnant. Regular checkups with your healthcare provider will ensure any potential issues are addressed promptly, and you receive appropriate guidance throughout your pregnancy. Point 2. A balanced diet. Maintain a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Adequate nutrition is crucial for a healthy pregnancy and can help reduce the risk of complications. Point 3. Avoid harmful substances. Stay away from alcohol, tobacco, and recreational drugs during pregnancy. These substances can increase the risk of miscarriage and negatively impact fetal development. Point 4. Limit caffeine. Moderate your caffeine intake. High amounts of caffeine have been associated with a higher risk of miscarriage, so it's best to limit your daily intake to a safe level. Point 5. Manage stress. Find healthy ways to manage stress, as excessive stress may be linked to an increased risk of miscarriage. Consider relaxation techniques, such as meditation, yoga, or gentle exercise. Point 6. Avoid certain medications. Consult your healthcare provider before taking any medications, including over-the-counter drugs and herbal supplements. Some medications may pose risks during pregnancy and could contribute to miscarriage. Point 7. Gentle exercise. Engage in gentle exercises like walking or prenatal yoga, as approved by your healthcare provider. Regular physical activity can improve blood circulation and promote overall well-being. Point 8. Maintain a healthy weight. Strive to maintain a healthy weight during pregnancy. Being either underweight or overweight can increase the risk of complications, including miscarriage. Point 9. Stay hydrated. Drink plenty of water throughout the day to stay hydrated. Proper hydration supports your body's functions and ensures a healthy environment for your developing baby. Point 10. Monitor chronic conditions. If you have any chronic health conditions, such as diabetes or hypertension, work closely with your healthcare provider to manage them effectively during pregnancy. Conclusion. Remember, every pregnancy is unique, and these tips should serve as general guidelines. If you experience any concerning symptoms or have specific health concerns, don't hesitate to reach out to your healthcare provider. Take good care of yourself, and we wish you a healthy and happy pregnancy journey. Don't forget to like this video and subscribe to our channel for more helpful content. Thanks for watching, and we'll see you next time. Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. Or having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content. Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting journey ahead. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3. Fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4. Nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5. Frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6. Food aversions and cravings. Your taste preferences might suddenly change. Cravings for specific foods or aversions to others could be a sign. Point 7. Mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time. Welcome to our YouTube video on the crucial role of vitamin B1 in maintaining a healthy life. Vitamin B1, also known as thiamine, is a water-soluble vitamin that plays a vital role in energy metabolism and overall well-being. Point 1. Energy metabolism. Boost. Vitamin B1 helps convert food into energy by aiding in the breakdown of carbohydrates. Without sufficient vitamin B1, your body's energy production could suffer, leading to fatigue and decreased vitality. Point 2. Nervous system support. Thiamine is essential for maintaining a healthy nervous system. It ensures proper functioning of nerve cells, contributing to cognitive functions and overall brain health. Point 3. Cardiovascular health. Vitamin B1 contributes to a healthy heart by assisting in the production of red blood cells. These cells transport oxygen throughout the body, ensuring optimal cardiovascular function. Point 4. Digestive system function. Thiamine plays a role in maintaining a healthy digestive system by promoting proper muscle tone in the digestive tract. This helps prevent digestive issues and supports efficient nutrient absorption. Point 5. Antioxidant defense. Vitamin B1 has antioxidant properties that help protect cells from oxidative stress and damage. By neutralizing harmful free radicals, it supports overall cell health and reduces the risk of chronic diseases. Point 6. Rich food sources. Include a variety of foods in your diet that are rich in vitamin B1. Good sources include whole grains, legumes, nuts, seeds, lean meats, fish, and dairy products. Point 7. Daily recommended intake. The recommended daily intake of vitamin B1 varies based on factors such as age, gender, and lifestyle. It's important to meet your daily requirements to ensure optimal health and well-being. Point 8. Deficiency symptoms. A deficiency in vitamin B1 can lead to health issues such as beriberi, characterized by muscle weakness, fatigue, and nerve problems. Ensuring an adequate intake helps prevent these symptoms and promotes overall health. Conclusion. Vitamin B1 is an essential nutrient that plays a crucial role in maintaining various bodily functions. By including vitamin B1-rich foods in your diet, you can support energy metabolism, nervous system health, cardiovascular function, and more. Remember to consult a healthcare professional before making significant changes to your diet or supplement routine. Don't forget to like, share, and subscribe for more informative videos on health and nutrition. Hello everyone, and welcome back to our channel. Today, we're diving into the wonderful world of vitamin B12, a vital nutrient that plays a crucial role in our health. In this video, we'll explore the top benefits of vitamin B12 and highlight some foods that are rich in this essential nutrient. So, let us get started. Point 1. Boosts energy and reduces fatigue. Vitamin B12 helps convert food into energy, aiding in the production of red blood cells. Adequate B12 levels can help fight fatigue and boost your overall energy levels. Point 2. Supports brain function. Vitamin B12 is essential for proper neurological function and brain health. It helps in the production of neurotransmitters, which are vital for mood regulation and cognitive function. Point 3. Rich in animal products. Many animal-based foods are excellent sources of vitamin B12. Fish, such as salmon and trout, along with lean meats and dairy products, are great options to include in your diet. Point 4. Plant-based sources. While B12 is predominantly found in animal products, there are some plant-based sources like fortified cereals, plant-based milk, and nutritional yeast. Point 5. Supports nervous system health. Vitamin B12 plays a vital role in maintaining a healthy nervous system. It contributes to the protection of nerve cells' outer layer, promoting overall nerve health. Point 6. Incorporate leafy greens. Some plant foods, like spinach and other leafy greens, contain small amounts of B12. While not as potent as animal sources, they can still contribute to your intake. Point 7. Importance for vegans and vegetarians. For those following a vegan or vegetarian diet, it's crucial to consider B12 supplements or fortified foods to ensure adequate intake. Point 8. Recommended daily intake. The recommended daily intake of vitamin B12 varies by age and gender. It's generally around 2.4 micrograms for adults. Point 9. Cooking tips to preserve vitamin B12 content. Avoid overcooking foods, as it is sensitive to high temperatures. Steaming or microwaving is better than boiling. Point 10. Eggs and dairy. Eggs and dairy products like milk and cheese are excellent sources of vitamin B12. They can be a convenient and tasty way to meet your B12 needs. There you have it, folks. The amazing benefits of vitamin B12 and some fantastic food sources to keep your levels in check. Remember, maintaining proper vitamin B12 intake is essential for your overall well-being. If you found this video helpful, don't forget to hit that like button, subscribe, and share it with your friends. Thanks for tuning in, and we'll see you in the next video. Welcome back to our channel, where we provide valuable information and support for those on their journey from infertility to fertility. Today, we'll be discussing the step-by-step process of transitioning from infertility to achieving a successful pregnancy. If you're new here, don't forget to hit the subscribe button and the notification bell so you won't miss any of our informative videos. Let us dive right into it. Step 1. Seeking professional help. The first crucial step in the journey is seeking professional help. Consult a reproductive endocrinologist or fertility specialist to evaluate your medical history, conduct tests, and diagnose any underlying issues causing infertility. Step 2. Diagnosis and treatment plan. Once diagnosed, your fertility specialist will create a personalized treatment plan. This may include lifestyle changes, medications, or advanced assisted reproductive technologies like in vitro fertilization (IVF), intrauterine insemination (IUI), or egg freezing. Step 3. Lifestyle and dietary changes. Making positive lifestyle changes can significantly impact your fertility. Maintain a healthy weight, exercise regularly, and consume a balanced diet rich in vitamins, minerals, and antioxidants. Reducing stress through activities like yoga or meditation can also be beneficial. Step 4. Medications and hormonal therapy. In some cases, hormonal imbalances may be causing infertility. Your specialist might prescribe medications to regulate your hormones and improve your chances of conception. Step 5. Assisted reproductive technologies (ART). When other methods aren't successful, you may explore assisted reproductive technologies such as IVF. This involves fertilizing eggs with sperm in a laboratory and transferring the resulting embryos into the uterus. Step 6. Egg or sperm donation. If needed, you may consider using donated eggs or sperm. This option is often chosen when a partner has low-quality eggs or sperm or in cases of same-sex couples. Step 7. Surrogacy. Surrogacy is another option for individuals or couples who can't carry a pregnancy themselves. A surrogate mother carries the pregnancy on behalf of the intended parents. Step 8. Adoption. If achieving a biological pregnancy isn't possible, adoption is a wonderful way to build a family. Adoption agencies can help match you with a child, and the process varies by country and jurisdiction. Step 9. Emotional support. Throughout this journey, emotional support is essential. Consider joining support groups, seeking therapy, or confiding in close friends and family members who can provide comfort and understanding. Step 10. Patience and persistence. Remember, the path from infertility to fertility can be challenging, but staying patient and persistent is key. Celebrate small victories, lean on your support network, and never lose hope. Conclusion, host, that wraps up our step-by-step guide on transitioning from infertility to fertility. We hope you found this information helpful and encouraging. If you have any questions or would like us to cover specific topics in the future, please leave a comment below. Don't forget to give this video a thumbs up and share it with anyone who might benefit. Thank you for watching, and we'll see you in the next video. Stay strong and keep believing in the possibility. Greet the viewers and introduce the topic of the ultimate baby shower. Explain that you'll be sharing a point-by-point guide to plan the perfect baby shower. Point 1. Choosing the date and venue. Discuss the importance of selecting a suitable date and venue for the baby shower. Provide tips on considering the mother-to-be's schedule and preferences. Suggest potential venue options, such as a cozy home, a rented event space, or a park. Point 2. Guest list and invitations. Emphasize the significance of creating a well-thought-out guest list. Offer suggestions for choosing friends and family members close to the expectant parents. Explain various ways to send out invitations, whether traditional printed cards or digital e-invites. Point 3. Theme and decorations. Highlight the fun of choosing a theme that reflects the parents' personalities or the baby's gender if known. Provide DIY decoration ideas or links to creative baby shower decor tutorials. Discuss options for themed table settings, banners, and centerpieces. Point 4. Food and refreshments. Discuss the importance of catering to different dietary preferences and restrictions. Suggest popular baby shower food options like finger foods, snacks, and desserts. Include tips for arranging a food and refreshments display that complements the theme. Point 5. Games and activities. List engaging baby shower games suitable for all guests. Explain how to organize and facilitate the games effectively. Suggest prizes for the winners to make it more enjoyable. Point 6. Gifts and registry. Talk about creating a baby registry to guide guests in gift selection. Discuss the importance of practical and thoughtful gifts for the baby and parents. Remind viewers to express gratitude to guests for their thoughtful presents. Point 7. Entertain. Welcome back to our channel. Today, we have an exciting baby food recipe that promotes healthy weight gain in infants. Remember, always consult your pediatrician before introducing new foods to your baby's diet. Point 2. Ingredients: 1 ripe avocado, 1 ripe banana, 1 4-cup cooked sweet potatoes, 2 tablespoons plain whole milk yogurt for babies over 6 months, 1 tablespoon coconut oil, 1 4-cup breast milk or formula. Adjust quantity as needed. Optional. 1 teaspoon of ground oats for added thickness. Point 3. Benefits of ingredients: avocado provides healthy fats and calories to support weight gain. Banana is rich in natural sugars, fiber, and essential vitamins. Sweet potatoes offer complex carbohydrates and vitamins. Whole milk yogurt contains healthy fats and calcium. Breast milk or formula ensures the necessary nutrients for growth. Point 4. Preparation: mash the ripe avocado and banana together in a bowl until smooth. Add the cooked sweet potatoes and mash thoroughly. Incorporate the plain whole milk yogurt and mix well. Drizzle in the coconut oil and stir until fully blended. If needed, add breast milk or formula to achieve the desired consistency. Point 5. Nutritious and delicious. This baby food recipe is packed with healthy fats, essential nutrients, and natural sweetness. It's crucial to offer balanced meals to support your baby's overall development. Point 6. Feeding tips: start with small portions to ensure your baby tolerates the new food well. Observe any allergic reactions or digestive issues after introducing the recipe. Gradually increase the serving size as your baby adjusts to the new food. Point 7. Time to serve. Spoon the baby food into a clean bowl and feed your little one with a soft, baby-friendly spoon. Always supervise your baby during feeding to avoid choking hazards. Point 8. Conclusion: we hope you enjoy making and serving this baby food recipe for healthy weight gain. Don't forget to give it a thumbs up if you found this video helpful, and subscribe to our channel for more baby care tips and recipes. Thanks for watching, and we'll see you in the next video. Hello everyone, welcome back to our channel. Today, we are going to discuss the early signs of labor that expectant mothers should be aware of. If you're new here, consider subscribing and hit that notification bell so you won't miss any updates. Let us get started. The first sign is lightening. This occurs when the baby drops lower into the pelvis, relieving pressure on the diaphragm. Moms-to-be might feel increased pelvic pressure and notice their baby bump is lower. Braxton Hicks contractions. Next up, Braxton Hicks contractions. These are irregular, painless contractions that help prepare the uterus for labor. They may feel like a tightening or hardening of the belly. Increased discharge. As labor approaches, you might experience increased vaginal discharge. This is known as the mucus plug, and it protects the cervix during pregnancy. Losing it is a sign that labor could be near. Nesting instinct. Feeling an uncontrollable urge to clean and organize, that's the nesting instinct kicking in. Many expectant mothers experience this surge of energy right before labor. Diarrhea or nausea. Hormonal changes can lead to gastrointestinal changes too. Diarrhea or nausea might occur as your body prepares for labor. Back pain. Persistent lower back pain can be a sign of labor, as the baby's head presses down on the pelvis and sacrum. Brains. When the amniotic sac ruptures, commonly known as the water breaking, it's a clear indication that labor is imminent. This might be a contractions. Last but not least, true labor contractions. These are regular, progressively intensifying contractions that help the face. Conclusion. Remember, every pregnancy is different, and not all women will experience these signs. If you notice any of these signs or have concerns, always reach out to your healthcare provider. Stay tuned for more pregnancy-related content and take care. See you in the next video. Outro. Think helpful, give it a thumbs up and share. It occurs when a sperm fertilizes an egg, forming a zygote. This tiny cluster of cells begins its journey towards the uterus. Week 2 implantation. Host. By week 2, the zygote implants itself into the uterine lining, where it will receive nourishment and continue its rapid division and growth. Week 3 embryonic development. Host. During week 3, the zygote becomes an embryo, and its cells start differentiating into the brain, spinal cord, and other essential structures. Week 4 heartbeat. Host. In the 4th week, the heart starts to beat, and the embryo begins to take on a recognizable shape. It's about the size of a poppy seed at this stage. Week 5 nervous system. Host. By week 5, the nervous system starts developing, and limb buds appear, which will eventually grow into arms and legs. Week 6 facial features. Host. In week 6, the embryo's facial features, such as eyes, ears, and a mouth, begin to form. Week 7 organ development. Host. Week 7 marks the beginning of organ development, with the brain, lungs, liver, and kidneys all starting to take shape. Week 8 fetal stage. Host. At week 8, the embryo officially becomes a fetus. It's about the size of a raspberry and can start moving its limbs. Week 9-12 rapid growth. Host. During weeks 9 to 12, the fetus undergoes rapid growth. Its sex organs start to form, and it can make small movements, though the mother cannot feel them yet. Week 13 trimester 1 ends. Host. At week 13, the first trimester comes to an end. The fetus is now about the size of a lemon, and its tiny fingerprints are forming. Week 14-16 developing senses. Host. In weeks 14 to 16, the fetus's senses begin to develop. It can now hear sounds from the outside world and may even suck its thumb. Week 17-20 movement sensation. Host. During weeks 17 to 20, the mother starts to feel the baby's movements. The fetus's skin becomes covered with vernix, a protective waxy substance. Week 21-24 viability. Host. At weeks 21 to 24, the fetus reaches the age of viability, where it has a chance of survival outside the womb with medical assistance. Week 25-28 rapid brain development. Host. During weeks 25 to 28, the baby's brain undergoes significant development. The eyes open and close, and the fetus has distinct sleep-wake cycles. Week 29-32 developing immune system. Host. In weeks 29 to 32, the baby's immune system strengthens as it receives antibodies from the mother. Week 33-36 lung development. Host. At weeks 33 to 36, the baby's lungs mature, and it assumes a head-down position in preparation for birth. Week 37 full term. Host. Congratulations! At week 37, the baby is considered full term, and it's now ready to be born. Week 38-39 final weeks. Host. In the final weeks, the baby drops lower into the pelvis, relieving pressure on the mother's diaphragm and making breathing easier. Birth. Host. And now, after an incredible journey of 39 weeks, it's time for the most momentous event, the birth of the baby. It's a miraculous and emotional experience that marks the beginning of a new chapter in the lives of both the parents and the newborn. Conclusion, host, pregnancy and baby development encompass an awe-inspiring process that showcases the wonders of life. From a single cell to a fully formed human being, these 39 weeks are filled with incredible growth, milestones, and changes. We hope you enjoyed this journey with us today. Outro, host, if you found this video informative and fascinating, don't forget to like and share it with others who might be interested. Subscribe to our channel for more captivating content on parenting, health, and lifestyle. Thanks for watching, and we'll see you in the next video. Hello and welcome back to our pregnancy journey. Today, we're diving into the incredible journey of week 37 of pregnancy. As we approach the final stretch, both you and your baby are going through significant changes. So, let us explore the symptoms and developments you can expect during this exciting time. But before we begin, don't forget to hit that subscribe button and ring the notification bell, so you don't miss any of our future videos. Week 37 marks the beginning of the 9th month of pregnancy, and your baby is almost ready to make their grand entrance into the world. Let us start by taking a look at the baby's development. At this stage, your baby weighs around 6.5 pounds 2.9 kilograms and measures approximately 19 inches 48 centimeters long. They are fully developed and are fine-tuning their systems for life outside the womb. Their organs, including the lungs, digestive system, and immune system, are all working in unison, preparing for the transition. Now, let us discuss the symptoms and changes you may experience during week 37. Increased pressure and discomfort. Host, as your baby continues to grow, you may experience increased pressure and discomfort in your pelvic region. This happens as your baby's head descends into the pelvis, preparing for birth. This can lead to a frequent need to urinate, difficulty walking, and even back pain. Braxton Hicks contractions. Host, you may also notice an increase in Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. These contractions are usually irregular and less painful than true labor contractions. Remember to stay hydrated and practice relaxation techniques to ease any discomfort. Fatigue and difficulty sleeping. Host, fatigue and difficulty sleeping can become more prominent during week 37. Your growing belly, frequent bathroom trips, and discomfort can make it challenging to find a comfortable position. Try using pillows for support and establishing a relaxing bedtime routine to improve your sleep. Increased vaginal discharge. Host, during this stage, you might notice an increase in vaginal discharge. This discharge, known as leukorrhea, helps prevent infections. However, if you experience any changes in color, consistency, or a foul odor, it's essential to consult your healthcare provider. Swelling and varicose veins. Host, swelling, especially in the feet and ankles, can become more pronounced at this stage of pregnancy. Additionally, you might notice the appearance of varicose veins due to increased blood volume and pressure. Elevating your legs, wearing compression stockings, and taking walks can help alleviate these symptoms. Emotional changes. Host, lastly, as your due date approaches, you might experience a mix of emotions, including excitement, nervousness, and even anxiety. It's essential to surround yourself with a support system and communicate your feelings with your loved ones. And that wraps up our journey through week 37 of pregnancy. It's amazing to see how far both you and your baby have come. Remember, each pregnancy is unique, so if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Stay tuned for our next video, where we'll discuss the final stages of pregnancy and the upcoming labor and delivery. Don't forget to like this video and leave a comment below if you found this information helpful. Until next time, take care and enjoy the remaining weeks of your pregnancy journey. Thank you for watching, and we'll see you soon. Greetings and welcome back to our Pregnancy Journey series. Today, we're diving into the incredible journey of the 36th week of pregnancy. As your due date gets closer, both you and your baby are experiencing some remarkable changes. Let's explore the symptoms you may encounter and the exciting developments happening to your little one. Maternal symptoms at 36 weeks. Increased discomfort. Your baby's growth puts additional pressure on your abdomen, causing discomfort and backaches. Frequent urination may persist as your baby continues to press on your bladder. Shortness of breath can occur due to limited space for your lungs. Braxton Hicks contractions. These contractions, also known as practice contractions, become more noticeable and frequent. They help prepare your body for labor, but they are usually irregular and mild. Swollen feet and ankles. Fluid retention can cause swelling in your feet and ankles. Elevating your legs and wearing comfortable shoes can help alleviate this symptom. Nesting instinct. Many women experience a strong urge to prepare their homes for the baby's arrival. This may involve cleaning, organizing, and setting up the nursery. Insomnia and fatigue. Discomfort, frequent bathroom trips, and hormonal changes can disrupt your sleep. Take short naps, practice relaxation techniques, and maintain a consistent sleep routine. Baby development at 36 weeks. Size and weight. Your baby is approximately 18 inches long and weighs around 6 pounds. Although still growing, they are almost fully developed. Fetal position. Most babies settle into the head-down position, preparing for birth. The head engages into the pelvis, which is a sign that labor might be approaching. Lung development. By 36 weeks, your baby's lungs have matured significantly. They continue to produce surfactant, a substance that helps the lungs expand and function properly after birth. Immune system. Your baby's immune system strengthens as they receive antibodies from you through the placenta. This provides them with some protection against infections early in life. Brain and nervous system. The brain development is almost complete, with rapid growth in the cerebral cortex. Your baby's nervous system is fully functional, and they can process information and regulate body temperature. Baby's movement. Due to limited space, you may feel more rolling and stretching movements instead of kicks. Hiccups are common as your baby practices swallowing and inhaling amniotic fluid. Preparations for the upcoming weeks. Finalize birth plan. Discuss your birth preferences with your healthcare provider and ensure they are included in your birth plan. Pack your hospital bag. As your due date nears, have a bag ready with essentials for you and your baby. Include comfortable clothing, toiletries, nursing bras, baby clothes, diapers, and important documents. Attend childbirth classes. Join childbirth education classes to learn about labor, pain management, and relaxation techniques. Discuss breastfeeding. Talk to your healthcare provider or a lactation consultant about breastfeeding techniques and potential challenges. Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty of rest. If you enjoyed this workout, consider subscribing. Hello, everyone. Welcome back to our channel. Today, we have an exciting topic for you: the top 10 low-calorie foods for a healthy weight loss lunch. If you're looking to shed some pounds or maintain a healthy weight, incorporating these nutritious and satisfying foods into your lunch can make a big difference. So, without further ado, let us dive into the list. Point 1. Leafy greens. Leafy greens, such as spinach, kale, and lettuce, are excellent choices for a low-calorie lunch. They are packed with fiber, vitamins, and minerals, and have very few calories. You can enjoy them in salads, wraps, or as a side dish. Point 2. Lean protein sources. Opt for lean protein sources like skinless chicken breast, turkey, tofu, or fish, which are low in calories and high in nutrients. Protein helps keep you feeling full for longer, making it an essential component of any weight loss lunch. Point 3. Colorful vegetables. Including a variety of colorful vegetables like bell peppers, carrots, broccoli, and zucchini in your lunch is a great way to add flavor, texture, and important nutrients while keeping the calorie count low. Point 4. Legumes. Legumes, such as lentils, chickpeas, and black beans, are not only rich in protein but also high in fiber. They provide a feeling of fullness and help control your appetite. Incorporate them into salads, soups, or stews for a filling and satisfying lunch. Point 5. Whole grains. Choose whole grains like quinoa, brown rice, or whole wheat bread instead of refined grains. Whole grains are higher in fiber, vitamins, and minerals, and they can help regulate blood sugar levels and promote satiety. Point 6. Greek yogurt. Greek yogurt is an excellent source of protein and probiotics, which promote a healthy gut. It makes for a delicious and filling lunch option, especially when paired with fresh fruits or nuts. Point 7. Soup. Having a bowl of vegetable-based soup for lunch can be both comforting and low in calories. Opt for broth-based soups with plenty of veggies and lean protein, and it will keep you satisfied without adding excessive calories. Point 8. Healthy salad dressings. Be mindful of the dressings you use on your salads. Opt for lighter options like lemon juice, balsamic vinegar, or Greek yogurt-based dressings, as they contain fewer calories compared to creamy dressings or oil-based ones. Point 9. Fruits. Fresh fruits are naturally low in calories and high in fiber, vitamins, and antioxidants. They make for a perfect dessert or snack option after your lunch, satisfying your sweet tooth while keeping your calorie intake in check. Point 10. Hydration. While not a specific food, staying hydrated is crucial for weight loss. Water has no calories and can help control your appetite. Make sure to drink enough water throughout the day, including during your lunchtime. Conclusion. That wraps up our list of the top 10 low-calorie foods for a healthy weight loss lunch. Incorporating these nutrient-dense and satisfying options into your meals can support your weight loss goals while keeping you nourished. Remember to combine them with regular physical activity for the best results. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more health and nutrition tips. Thanks for watching, and we'll see you in the next video. Welcome back to our channel, where we bring you the latest health tips and advice. Today, we're going to talk about a very important nutrient that our body craves: vitamin D. Did you know that your body can actually show you signs when it's begging for more vitamin D? In this video, we'll discuss 10 signs that your body may be lacking this crucial vitamin. So, let us get started. Number 1. Fatigue. Feeling excessively tired and lacking energy, even after a good night's sleep, can be a sign that your body needs more vitamin D. Low levels of this vitamin can impact your overall energy levels. Number 2. Frequent illness. If you find yourself getting sick more often than usual, it could be a sign that your immune system needs a boost. Vitamin D plays a vital role in supporting immune functions. So a deficiency can weaken your body's defenses. Number 3. Muscle and bone. D can contribute to hair thinning and loss. If you're experiencing excessive hair shedding, it might be worth considering your vitamin D levels. Number 6. Mood swings and depression. Low levels of vitamin D have been linked to mood disorders such as depression and anxiety. If you find yourself feeling down, irritable, or experiencing sudden mood swings, it could be a sign that you need more of this vital nutrient. Number 7. Bone pain. Deficiency in vitamin D can lead to a condition called osteomalacia, which causes weak and painful bones. If you frequently experience bone pain or tenderness, especially in your back, hips, or legs, it's important to check your vitamin D levels. Number 8. Sweaty head. Excessive sweating, particularly on the scalp, can be an indication of vitamin D deficiency. Pay attention to whether your head feels excessively sweaty even in cooler environments. Number 9. Impaired wound healing. If you notice that your cuts, scrapes, or bruises take longer to heal than usual, it may be a sign that your body lacks vitamin D. This nutrient plays a crucial role in the wound healing process. Number 10. Gut health issues. Vitamin D deficiency has been linked to digestive problems such as irritable bowel syndrome (IBS), Crohn's disease, and other inflammatory bowel conditions. If you're experiencing digestive issues, it's worth considering the role of vitamin D in your gut health. So, there you have it, 10 signs that your body may be begging for vitamin D. If you're experiencing any of these symptoms, it's essential to consult with your healthcare provider for proper diagnosis and treatment. That's all for today's video. If you found this information helpful, don't forget to give this video a thumbs up and subscribe to our channel for more health tips. Welcome back to our channel, where we bring you all the information you need on pregnancy and parenthood. In today's video, we'll be discussing 10 signs that indicate you might be expecting a baby boy. So, let us get started. 1. Increased appetite. One of the first signs of pregnancy is an increase in appetite. If you find yourself craving salty and savory foods rather than sweet and sour, it could be an indication that you're carrying a baby boy. 2. High baby bump. Another sign is the shape of your baby bump. Many believe that carrying low and having a more prominent belly at the front suggests you might be having a baby boy. 3. Rapid weight gain. If you notice that you're gaining weight more quickly than expected during pregnancy, it could be a sign of having a baby boy. Boys are often associated with more significant weight gain during pregnancy. 4. Heart rate. The baby's heart rate can also provide some clues. According to folklore, if your baby's heart rate is less than 140 beats per minute, it might be a boy. However, it's important to note that this method is not scientifically proven. 5. Dull complexion. Some people believe that carrying a boy can lead to a dull complexion during pregnancy. If you notice that your skin is lacking its usual glow, it might be an indication of a baby boy on the way. 6. Increased body hair. Another potential sign is an increase in body hair. Hormonal changes during pregnancy can cause excess hair growth, and some believe this can be more prominent when carrying a boy. 7. Emotional changes. Pregnancy often comes with emotional ups and downs, but if you're experiencing mood swings and irritability more frequently, it might be associated with carrying a baby boy. 8. Active baby. The level of activity of your baby in the womb can also be a sign. Boys are often known to be more active during pregnancy, so if you're feeling those kicks and movements more frequently, it could be an indication of a boy. 9. Intuition. Trust your maternal instincts. Many mothers claim to have a strong gut feeling about the gender of their baby, and oftentimes, these intuitions turn out to be correct. 10. Gender reveal. Lastly, the most definitive way to know the gender of your baby is through an ultrasound or genetic testing. So, make sure to schedule your gender reveal appointment with your healthcare provider to get an accurate confirmation. 11. Cold feet. It is believed that having cold feet during pregnancy is associated with carrying a baby boy. So, if you find yourself reaching for warm socks more often, it might be a clue about the gender. 12. Vivid dreams. Many pregnant women experience vivid dreams throughout their pregnancy. Some believe that having intense and memorable dreams could be a sign that you're carrying a baby boy. 13. Carrying wide. The way you carry your baby weight can also provide hints about the gender. If you notice that you're carrying wider around the waist rather than in the hips, it could suggest the arrival of a baby boy. 14. Urine color. Surprisingly, some believe that the color of your urine can guess gender. According to the old wives' tale, if your urine appears bright yellow, you might be having a boy. 15. Morning sickness. While morning sickness can occur with any pregnancy, some people believe that experiencing severe morning sickness might indicate you're carrying a baby boy. However, it's important to note that morning sickness varies for each individual and doesn't solely determine the gender. 16. Hair and nail growth. Some believe that rapid hair and nail growth during pregnancy can be associated with carrying a baby boy. If you notice your hair and nails growing faster than usual, it might be a sign of a little boy on the way. 17. Sleeping position. Your preferred sleeping position during pregnancy could also give a clue about the gender. It is said that if you find yourself favoring the left side, it might suggest that you're carrying a baby boy. 18. Baby's position in the womb. The position of the baby in the womb can also provide hints about their gender. If your baby is positioned lower in the pelvis, it could be an indication of a baby boy. 19. Lack of pregnancy glow. Pregnancy is often associated with a radiant glow on the skin. However, some believe that carrying a baby boy can result in a lack of that pregnancy glow, leaving your skin looking less luminous. 20. Linea nigra. The linea nigra is a dark line that appears on the abdomen during pregnancy. It is believed that if the line extends above the navel, it might be a sign of carrying a baby boy. Bonus sign 1. Craving for protein. Some old wives' tales suggest that if you have an increased craving for protein-rich foods like meat, poultry, and fish, it could be a sign that you're carrying a baby boy. Bonus sign 2. Father's weight gain. According to a popular belief, if the expectant father gains weight along with the pregnant mother, it could be an indication of having a baby boy. Bonus sign 3. Baby's position in ultrasound. During an ultrasound, the position of the baby's genitals can sometimes give a hint about their gender. However, it's important to note that ultrasound interpretations can vary, and it's not always 100% accurate. Bonus sign 4, no swelling. Some believe that if you're experiencing minimal or no swelling in your hands and feet during pregnancy, it could be associated with carrying a baby boy. Swelling, known as edema, is a common symptom in pregnancy, but it varies for each individual. Bonus sign 5, lack of skin changes. Skin changes, such as darkening of the areolas or the appearance of the pregnancy mask melasma, are common during pregnancy. However, if you don't experience significant skin changes, it might be linked to expecting a baby boy. Remember, these bonus signs are purely based on folklore and personal experiences, and their accuracy is not scientifically proven. They are meant to be lighthearted and fun, rather than definitive indicators of your baby's gender. As always, it's essential to consult with your healthcare provider for accurate information and to perform medical procedures, such as ultrasounds or genetic testing, to confirm the gender of your baby. We hope you enjoyed this comprehensive list of signs that some believe can indicate you're expecting a baby boy. If you found this video helpful or entertaining, please give it a thumbs up and share it with others who might enjoy it. Don't forget to subscribe to our channel for more informative and engaging content on pregnancy, parenthood, and everything in between. Thank you for being a part of our community and for your continued support. If you have any questions or suggestions for future videos, please leave them in the comments below. We appreciate your feedback. Take care of yourself, stay healthy, and best wishes for a happy and healthy pregnancy journey. We'll see you in our While there are numerous factors that can affect human health, here are 7 common things that can have a negative impact when experienced on a daily basis. Sedentary lifestyle, lack of physical activity and spending long periods sitting can lead to various health issues such as obesity, cardiovascular problems, muscle weakness, and decreased bone density. Unhealthy diet, consistently consuming a diet high in processed foods, added sugars, unhealthy fats, and low in essential nutrients can contribute to obesity, diabetes, heart disease, and other chronic conditions. Poor sleep habits, chronic sleep deprivation or inadequate sleep quality can impair cognitive function, weaken the immune system, increase the risk of obesity and diabetes, and contribute to mental health disorders. Chronic stress, prolonged exposure to stress, whether it be due to work, relationships, or other factors, can lead to a range of health problems, including anxiety, depression, digestive issues, weakened immune function, and increased risk of cardiovascular disease. Smoking and substance abuse, daily smoking or excessive consumption of alcohol, illicit drugs, or prescription medications can severely damage various organs and systems in the body, including the lungs, liver, brain, and cardiovascular system. Environmental pollution, regular exposure to air and water pollution, harmful chemicals, toxins, and hazardous substances can increase the risk of respiratory diseases, cancer, neurological disorders, and other health complications. Lack of hydration, failing to drink an adequate amount of water each day can result in dehydration, leading to fatigue, impaired cognitive function, digestive problems, reduced physical performance, and potential complications for various organs. It is important to note that individual circumstances may vary, and the impact of these factors on health can be influenced by genetic predispositions, lifestyle choices, and overall health status. Adopting healthier habits, such as engaging in regular exercise, maintaining a balanced diet, getting sufficient sleep, managing stress, avoiding harmful substances, and practicing good hygiene, can significantly improve overall well-being. Greetings and welcome back to our channel. Today, we're diving into a topic that is often overlooked, spoon feeding. We've all heard about the concept of spoon feeding, but there's more to it than meets the eye. In this video, we'll shed light on the unspoken truths about spoon feeding, exploring its effects on personal growth, learning processes, and long-term development. The illusion of mastery. Spoon feeding can create an illusion of mastery in learners. When information is handed to us on a silver platter, we might feel a false sense of accomplishment. True mastery comes from actively engaging with the learning process, embracing challenges, and working through obstacles. 2. Inhibition of critical thinking. Spoon feeding can hinder the development of critical thinking skills. Without the need to actively analyze and evaluate information, learners may struggle to think independently. Critical thinking is essential for problem solving, decision making, and innovation. 3. Lack of resilience. Spoon feeding diminishes the opportunity to develop resilience. Overcoming difficulties and setbacks is crucial for personal growth. When we're consistently spoon-fed, we miss out on valuable lessons in perseverance and resilience. 4. Absence of creativity. Creativity flourishes when individuals are challenged to think beyond what is given. Spoon-feeding limits the scope for originality and stifles creative thinking. Nurturing creativity involves fostering curiosity, exploration, and open-ended learning experiences. Failure to develop self-reliance. Spoon-feeding can breed dependency on external sources for information. It neglects the cultivation of self-reliance and the ability to seek answers independently. Empowering learners to become self-reliant prepares them for real-world challenges and lifelong learning. 6. Impacts on long-term retention. When information is spoon-fed, retention may be compromised. Active learning methods, such as self-study and problem-solving, enhance long-term memory retention. Engaging in the learning process through active participation promotes better knowledge retention and recall. 7. Limitations in real-world application. Spoon-feeding often fails to bridge the gap between theoretical knowledge and real-world application. Practical skills and problem-solving abilities are best developed through hands-on experiences. Simply memorizing information without understanding its real-world implications may hinder future success. Conclusion: spoon-feeding, while seemingly convenient, comes with its own set of drawbacks that are often overlooked. Emphasizing active learning, critical thinking, resilience, and creativity fosters a well-rounded individual. Let us shift our focus from spoon-feeding to empowering learners to become independent thinkers and lifelong learners. We hope this video has shed light on the unspoken truths about spoon-feeding, inspiring you to approach education and personal growth in a more proactive and holistic manner. Outro. Thank you for joining us today. We hope you found this video informative and thought-provoking. If you enjoyed this content, don't forget to like, share, and subscribe to our channel for more insightful discussions. Let us know your thoughts and experiences with spoon-feeding in the comments section below. Until next time, keep exploring, learning, and challenging yourself. Welcome back to our YouTube channel. Today, we're diving into the topic of intermediate fasting and how it can help with weight loss. Intermediate fasting has gained significant popularity in recent years due to its effectiveness in promoting weight loss and improving overall health. In this video, we'll discuss the concept of intermediate fasting, its benefits, and how it can be implemented to achieve successful weight loss. What is intermediate fasting? Intermediate fasting is an eating pattern that cycles between periods of fasting and eating. It does not focus on what you eat, but rather when you eat. The most common approach is the 16-8 method, where you fast for 16 hours and limit your eating window to 8 hours each day. During the fasting period, you consume 0 or minimal calories, typically by skipping breakfast and extending the overnight fast. How does intermediate fasting aid in weight loss? Calorie restriction. Intermediate fasting naturally reduces your daily calorie intake by limiting the number of hours you have to eat. Increased fat burning. When you fast, your body exhausts its glycogen stores and starts burning stored fat for energy. Improved insulin sensitivity. Intermediate fasting can enhance insulin sensitivity, reducing the risk of insulin resistance and weight gain. Boosts metabolism. Studies suggest that intermittent fasting can increase metabolism, helping you burn more calories throughout the day. Benefits of intermediate fasting beyond weight loss. Cellular repair. During fasting, your body initiates cellular repair processes, such as autophagy, which remove damaged cells and waste materials. Reduced inflammation. Fasting has been shown to reduce inflammation levels in the body, which is associated with various chronic diseases. Mental clarity. Many people report improved mental focus and clarity during fasting periods. Longevity. Some studies suggest that intermittent fasting may promote longevity and delay the aging process. Tips for successful intermediate fasting. Start slow. If you're new to intermediate fasting, begin with a shorter fasting window, such as 12 hours, and gradually increase it over time. Stay hydrated. Drink plenty of water, herbal tea, or black coffee during fasting periods to stay hydrated and curb hunger. Balanced diet. While intermittent fasting doesn't restrict what you eat, it's essential to focus on a balanced and nutritious diet during your eating window. Include whole foods such as fruits, vegetables, lean proteins, and healthy fats. Avoid excessive consumption of processed foods, sugary drinks, and refined carbohydrates. Listen to your body. If you feel unwell or overly hungry, it's important to listen to your body and adjust your fasting schedule accordingly. Exercise. Incorporate regular physical activity into your routine, as it can enhance the weight loss benefits of intermediate fasting. Common misconceptions about intermediate fasting. Starvation mode. Fasting does not lead to starvation mode where your body holds on to fat. It is a natural metabolic state designed to utilize stored energy. Skipping meals. Intermittent fasting is not about skipping meals altogether but rather condensing your eating window into a specific timeframe. Weight loss miracle. While intermediate fasting can be a powerful tool for weight loss, it's not a magic solution. It should be combined with a healthy lifestyle, including regular exercise and a balanced diet. Conclusion. Intermediate fasting can be an effective strategy for weight loss, along with numerous health benefits. It helps you naturally reduce calorie intake, burn fat, improve insulin sensitivity, and boost metabolism. Remember to start slowly, stay hydrated, maintain a balanced diet, and incorporate exercise for optimal results. If you're considering intermediate fasting, consult with a healthcare professional, especially if you have any underlying health conditions. Thank you for watching. Don't forget to like this video, subscribe to our channel, and share it with others who might find it helpful. Stay healthy and see you in the next video. Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Welcome back to our channel. Today, we will be discussing an essential nutrient that plays a vital role in maintaining our overall health and well-being, vitamin A. In this video, we will explore the numerous benefits of vitamin A, its food sources, and why it is necessary for our bodies. So, let us dive right in. Point 1. Importance of vitamin A. Vitamin A is a fat-soluble vitamin that is crucial for various bodily functions. It acts as an antioxidant, helping to protect our cells from damage caused by harmful free radicals. Additionally, it plays a vital role in maintaining healthy vision, supporting the immune system, promoting growth and development, and ensuring proper functioning of organs like the heart, lungs, and kidneys. Point 2. Promotes healthy vision. One of the most well-known benefits of vitamin A is its role in promoting good vision. It is an essential component of rhodopsin, a protein in the retina that enables us to see in low light conditions. Adequate vitamin A intake reduces the risk of night blindness and helps maintain overall eye health. Point 3. Boosts immune system. Vitamin A is a potent supporter of the immune system. It helps in the production and function of white blood cells, which are responsible for fighting off infections and diseases. A well-functioning immune system can protect us from various illnesses, including respiratory infections, common colds, and even certain types of cancer. Point 4. Supports growth and development. Vitamin A plays a crucial role in the growth and development of our bodies. It is particularly important for children, as it aids in the development of strong bones and teeth, and supports proper organ development. Pregnant women require sufficient vitamin A for fetal development, including the formation of the heart, lungs, kidneys, and other vital organs. Point 5. Skin and tissue health. Another fantastic benefit of vitamin A is its ability to promote healthy skin and tissues. It helps in the production and maintenance of skin cells, keeping the skin smooth, soft, and radiant. Vitamin A also aids in wound healing, ensuring that our body repairs damaged tissues effectively. Point 6. Food sources of vitamin A. Now that we understand the importance of vitamin A, let us talk about some of the best food sources to incorporate into our diet. Rich sources of preformed vitamin A include liver, fish oil, and dairy products like cheese, butter, and whole milk. These foods contain a type of vitamin A known as retinol, which our bodies can readily utilize. Point 7. Plant-based sources of vitamin A. You prefer a plant-based diet? Don't worry. There are plenty of options for obtaining vitamin A from plant sources. Fruits and vegetables that are orange or yellow in color, such as carrots, sweet potatoes, mangoes, and papayas, are excellent sources of beta-carotene. Our bodies convert beta-carotene into vitamin A, ensuring we receive the necessary nutrient. Point 8. Ensuring adequate vitamin A intake. While it's important to consume foods rich in vitamin A, it's equally crucial to maintain a balanced diet. Eating a variety of fruits, vegetables, dairy products, and lean meats can help ensure you meet your vitamin A requirements. However, if you struggle to obtain sufficient vitamin A through your diet, you may consider a multivitamin or consult a healthcare professional for guidance. Conclusion: vitamin A is a powerful nutrient that offers numerous benefits for our overall health. From promoting healthy vision and supporting the immune system to aiding.
Welcome back, foodies. Today, we're diving into the world of vitamin B and its incredible benefits. Vitamin B is a group of essential nutrients that play a vital role in maintaining good health and well-being. So, let us explore the fantastic benefits of vitamin B and discover some delicious foods rich in these essential vitamins. Before we dive into the benefits, let us get to know the different types of vitamin B. There are 8 B vitamins, each with its unique functions. They are B1 thiamine, B2 riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B7 biotin, B9 folate, and B12 cobalamin. Point 1. Energy production. Vitamin B is a key player in energy production. These vitamins help convert the food we eat into energy that our bodies can use. So, if you ever feel fatigued or low on energy, incorporating vitamin B-rich foods into your diet might just be the boost you need. Point 2. Healthy skin and hair. Who doesn't want radiant skin and luscious hair? Well, vitamin B can help you achieve just that. Biotin, in particular, is known for promoting healthy hair, skin, and nails. It's like nature's beauty secret. Point 3. Strong nervous system. Vitamin B6 is a superstar when it comes to supporting our nervous system. It plays a crucial role in neurotransmitter function, which helps our brain send messages to the rest of our body. Keeping our nervous system healthy is essential for overall well-being. Point 4. Heart health. Taking care of our heart should be a top priority, and vitamin B can lend a hand here too. Vitamin B1 and B3 help maintain a healthy cardiovascular system by promoting proper circulation and reducing harmful cholesterol levels. Point 5. Improved digestion. Have you ever experienced digestive issues like bloating or indigestion? Vitamin B5 comes to the rescue. This vitamin aids in breaking down fats and carbohydrates, ensuring your digestive system runs smoothly. Point 6. Mood and brain function. Feeling a bit down lately? Vitamin B6 and B12 can contribute to better mood regulation and cognitive function. They help produce neurotransmitters like serotonin and dopamine, which are essential for a positive outlook on life. Point 7. Red blood cell formation. Our blood needs to be healthy and efficient in carrying oxygen throughout the body. Vitamin B9, also known as folate, is crucial for red blood cell formation. It's particularly vital during pregnancy to support the baby's development. Point 8. Immune system support. A strong immune system is our shield against illnesses, and vitamin B6 can bolster it. This vitamin helps in the production of antibodies, strengthening our immune response. Welcome back, Health Today. We are diving into the wonderful world of vitamin C, a powerhouse nutrient with numerous health benefits. Whether you're looking to boost your immune system or enhance your skin's radiance, vitamin C has got you covered. In this video, we'll explore the incredible advantages of vitamin C and some of the best food sources to incorporate into your diet. So, let us get started. Segment 1, Introduction to Vitamin C. Before we jump into the benefits, let us understand what vitamin C is. Also known as ascorbic acid, vitamin C is an essential water-soluble vitamin. Unfortunately, our bodies cannot produce it, so we must obtain it through our diet. This antioxidant vitamin plays a crucial role in maintaining overall health and well-being. Segment 2, Immune System Boost. One of the most well-known benefits of vitamin C is its role in boosting the immune system. It enhances the production of white blood cells, which are essential for fighting off infections and illnesses. Regular intake of vitamin C can help reduce the severity and duration of colds and flu. Segment 3, Collagen Production. Vitamin C is a vital component in collagen synthesis. Collagen is the main structural protein in our skin, responsible for its elasticity and firmness. By promoting collagen production, vitamin C helps maintain youthful-looking skin and prevents premature aging. Segment 4, Antioxidant Properties. As an antioxidant, vitamin C neutralizes free radicals in the body, which are unstable molecules that can cause cellular damage. By doing so, it helps reduce the risk of chronic diseases like heart disease, cancer, and arthritis. Segment 5, Cardiovascular Health. Vitamin C supports heart health by improving blood vessel function and reducing blood pressure levels. Studies have shown that a higher intake of vitamin C is associated with a reduced risk of heart disease. Segment 6, Iron Absorption. Did you know that vitamin C enhances the absorption of non-heme iron from plant-based foods? Consuming vitamin C-rich foods alongside iron-rich foods can improve iron absorption and prevent anemia. Segment 7, Mood Booster. Vitamin C isn't just good for your physical health, it can also have a positive impact on your mood. Some studies suggest that vitamin C may help reduce stress and improve overall mood. Segment 8, Vitamin C-rich foods. Now that we've explored the amazing benefits of vitamin C, let us dive into some of the best food sources rich in this essential nutrient. Citrus fruits. Oranges, lemons, grapefruits, and tangerines are classic examples of vitamin C-rich fruits. Just one medium-sized orange can provide your daily recommended intake of vitamin C. Berries, strawberries, blueberries, raspberries, and blackberries are not only delicious but also packed with vitamin C. Kiwi. This small green fruit is a vitamin C powerhouse. It also contains a good amount of fiber and other essential nutrients. Guava. Surprisingly, guava contains more vitamin C than many citrus fruits. Enjoy it as a tasty snack or blend it into a refreshing smoothie. Papaya. This tropical fruit is not only rich in vitamin C but also contains an enzyme called papain, which aids digestion. Bell peppers. Colorful bell peppers, especially the red ones, are fantastic sources of vitamin C. Add them to salads, stir-fries, or simply enjoy them raw. Broccoli. Among the cruciferous vegetables, broccoli stands out as an excellent source of vitamin C. Steam or lightly sauté it to retain its nutrients. Welcome back to our channel, where we explore the incredible benefits of various nutrients for a healthy lifestyle. Today, we're diving into the world of vitamin K. In this video, we'll discuss the numerous benefits of this essential nutrient and explore some of the best food sources to incorporate into your diet. So, let us get started. Before we jump into the foods, let us talk about why vitamin K is so important for our bodies. Here are the top benefits. Blood clotting. Vitamin K plays a vital role in blood clotting, helping to prevent excessive bleeding when we're injured. It activates certain proteins that work together to form blood clots and promote wound healing. Bone health. Vitamin K is necessary for the synthesis of osteocalcin, a protein essential for bone mineral. It helps improve bone density, reducing the risk of fractures and osteoporosis, especially in older adults. Heart health. Studies suggest that vitamin K can help maintain cardiovascular health. It helps prevent the calcification of arteries, reducing the risk of heart disease and improving overall heart function. Brain health. Vitamin K has been linked to brain health and cognitive function. It is believed to play a role in maintaining the myelin sheath, a protective covering of nerve cells, thus supporting healthy brain function. Anti-inflammatory properties. Vitamin K has anti-inflammatory properties that help combat inflammation in the body. It may provide relief for conditions like arthritis and reduce the risk of chronic inflammatory diseases. Cancer prevention. Some studies indicate that vitamin K may have a protective effect against certain types of cancer, including liver, colon, and prostate cancers. It is believed to inhibit the growth of cancer cells and support the body's natural defense mechanisms. Now that we understand the incredible benefits of vitamin K, let us explore some fantastic food sources to incorporate into your daily diet. Leafy greens. Dark leafy greens are rich in vitamin K. Spinach, kale, Swiss chard, and collard greens are excellent options. You can enjoy them raw in salads, sautéed as a side dish, or blended into a refreshing green smoothie. Cruciferous vegetables, broccoli, Brussels sprouts, and cauliflower are not only packed with vitamins and minerals but also contain a good amount of vitamin K. These versatile veggies can be roasted, steamed, or stir-fried to add a nutritious punch to your meals. Herbs and spices. Fresh herbs like parsley, basil, and cilantro, along with spices such as thyme and sage, are great sources of vitamin K. Add them to your recipes for added flavor and health benefits. Green peas. These little green gems are not only delicious but also a good source of vitamin K. Add them to salads, stir-fries, or enjoy them as a side dish to boost your vitamin K intake. Fermented foods. Certain fermented foods, such as natto, a traditional Japanese dish made from fermented soybeans, contain significant amounts of vitamin K2. Incorporating these foods into your diet can provide you with additional health benefits. Now that you know the incredible benefits of vitamin K and the rich food sources, let us talk about daily intake and some final thoughts. The recommended daily intake of vitamin K varies depending on age and gender. For adult men, it is around 120 micrograms mg per day, while adult women need approximately 90 micrograms. It's essential to maintain a balanced diet that includes vitamin K-rich foods to meet these requirements. In conclusion, vitamin K is a powerhouse nutrient with numerous benefits. From supporting blood clotting and bone health to promoting heart and brain function, it plays a crucial role in our overall well-being. By incorporating vitamin K-rich foods into our diet, we can ensure we're reaping these benefits and maintaining optimal health. Remember to consult with a healthcare professional before making any significant dietary changes, especially if you have underlying health conditions or are taking medications. That's it for today's video. If you found this information helpful, give it a thumbs up, and don't forget to subscribe to our channel for more exciting content. As always, stay healthy, stay informed, and we'll see you in the next video.